Hello, guys. Very good evening to all of you. And today is a brief session about quick revision of the entire pharmacology in around one and a half hours. I'll try to wrap it up, and it's not an MCQ based discussion. Basically, I'll be talking about what is more commonly asked in each and every topic. So we'll just brush up, and I hope you guys have come prepared. आप लोग पढ़ के आए हैं. In this session, you'll just actively recall. I'll just ask you the questions. You have to participate. You have to answer, and we'll be done with it. Good evening, guys. And of course, I'll solve some doubts as well. And any doubts you have at the end, I can solve. That's not a big deal. So let's begin with the session. All right. So this is pharma checklist, and what does this checklist means? Checklist का मतलब क्या है? In every exam, you have definitely MCQs from certain topics. They're constant, right? And that is what most of the times is being asked, and we are going to be covering that. So this is how we're going to discuss this, right? Drug toxicity presents with meiosis, salivation, lacrimation, bradycardia, involuntary urination, defecation. So first of all, you can have a clinical case. This is very frequently asked. And once you have a look at these symptoms, you have to make a diagnosis, and then you have to find the treatment. So two types of MCQs are asked. Either they'll ask you, what am I dealing with? Second, they'll ask you, what is the treatment for this condition, right? All right, guys. So what is the diagnosis first of all? Come on, you have to participate, right? You have to participate, because I'm telling you, these are frequently asked. So first they'll ask you, what is the diagnosis? And they'll give you options: cholinergic poisoning, anticholinergic poisoning, sympathomimetic poisoning, sympatholytic poisoning. So one MCQ is on diagnosis. Excellent, guys. Excellent. So the diagnosis is, it is a case of cholinergic poisoning, like it can be organophosphates. Excellent. So see, look at these symptoms. First of all, the diagnosis is organophosphate poisoning. At last, I'll sum it up as well. Is cholinergic poisoning? Your answer would be cholinergic poisoning. Then they'll ask you, what is the treatment? What is the treatment, or what is the drug of choice? What is the drug of choice? So there are two MCQs. Excellent. The drug of choice is atropine. The drug of choice is atropine. So remember, in parasympathetic, in autonomic nervous system, the most commonly asked MCQ is based upon cholinergic and anticholinergic poisoning. Drug of choice is atropine. And then they ask you, till what time we give atropine, right? What is the marker that is used? How would you know in the emergency that I have to stop now? I have given enough atropine. And that is the marker. The most commonly used marker is pupil size. Most commonly used marker is pupil size. So if the pupil size is meiotic, or we call it as pinpoint pupil, once the pupil size becomes normal, we stop atropine. That is most common. Whereas most specific, if they ask you, it is respiratory secretions. It is respiratory secretions. So these are some important points which they ask you. Respiratory secretions, very good. These are most specific. Most common is pupil size, because measuring respiratory secretion is not that easy. So once you go to internship, you'll realize what you measure is pupil size. And at last, in this poisoning, if it is organophosphate poisoning, in that case, to atropine, I also add something called as pralidoxin. And if they ask you, what is the most specific drug for organophosphate poisoning, your answer is anoxime or pralidoxin. So first of all, diagnosis, cholinergic, like organophosphate poisoning. Treatment, atropine plus pralidoxin. Drug of choice is atropine. How do you monitor the effect of atropine? Pupil size most commonly. Which is the best? Which is the most specific? It is a respiratory secretion. So remember, this is what they ask. Now let us jump onto the second part. Let us jump onto the second part here. And this is mydriasis, hyperthermia. All right, so I'll use white color then, right? Mydriasis, hyperthermia, urine retention, tachycardia, delirium, right? So what is this? So the second case that we are discussing here. So one we discussed, it is cholinergic poisoning. See guys, everything is in your notes. No matter which teacher, which platform, which coaching institute you have studied, they have taught you this. So our aim today is not to write. Our aim today is whenever I'm asking, your aim is to recall and revise, right? So it's a case of basically I'll be fast, guys. I'll be fast because I don't want to waste your time. Anticholinergic poisoning. Anticholinergic poisoning, it can be poisoning of atropine or it can be datura poisoning. So first of all, an MCQ will be asked on diagnosis. So diagnosis, anticholinergic poisoning, atropine or datura. Excellent. So most of you have given the right answer. Now coming to treatment. Once they ask you treatment, what is the treatment? What is the treatment of this condition? Anticholinergic, atropine or datura poisoning. What is the treatment? What is the treatment? The treatment is excellent. The treatment is physostigmine. That's excellent, guys. You're getting into the groove. You're getting into the groove. The treatment is physostigmine. So here, two things to discuss: cholinergic poisoning, atropine; anticholinergic poisoning, physostigmine. So remember, nowadays the MCQs are not direct. So they'll give you clinical cases. So what you have to look at is always see. At last, I'll sum it up. You don't have much time, so look at the pupil size. So whenever you are suspecting parasympathetic nervous system toxicity, look at the pupil. Meiosis or mydriasis. If you look at meiosis, mydriasis, you might not have to look beyond that. But remember, meiosis, it is also seen with opioid. It is also seen with opioid. So how to differentiate? If there is respiratory depression, then it is opioid poisoning. It is not cholinergic poisoning. In cholinergic poisoning, there won't be respiratory depression, right? So respiratory depression, there would be opioid poisoning. So look carefully, not just look at pupil size. But anyways, if you're looking at other features, the second feature that you have to look at is the heart rate. If it is bradycardia, it is in cholinergic poisoning, there would be bradycardia. Tachycardia would be in anticholinergic poisoning. So excellent, guys. Cholinergic, anticholinergic. Let us move on to the second one. The MCQ. This one is frequently asked, and I'm just like they won't ask you nowadays a simple MCQ. They'll ask you, there is a patient who was, for example, he went for a picnic into the jungle, and then there was an insect bite, and after insect bite, he had all of a sudden swelling of the face, and he had difficulty breathing as well. So first of all, they might ask you, what is the diagnosis, right, guys? What is the diagnosis of this condition? Come on. What is the diagnosis? What is the diagnosis? What is the diagnosis, guys? What is the diagnosis of this condition? It has been asked in your FMGE exam. It has been asked multiple times, and believe me, it will be asked for the next 100 years. They are not going to change it. It is not scorpion bite, guys. It is not scorpion bite. See, in scorpion bite, you will have you will have hypertension, pulmonary edema, you can have seizure. So CVS and CNS is affected in scorpion bite, right? Yeah, now whenever you have edema of the face plus breathing difficulty, it is because of laryngeal edema. Remember, the diagnosis is I'm dealing with anaphylaxis. So remember, whenever they will ask you about, for example, see the scenarios are different, but the presentation is same. Breathing difficulty, right? Because of bronchoconstriction, because there is a release of histamine, and that histamine is a bronchoconstrictor. So there will be breathing difficulty plus laryngeal, edema can be seen. Plus there can be edema of the face, eyelids and lips would be swollen. History can be of insect bite or bee, honey bee bite. History can be consumption of some food like seafood or peanut butter, etc. Anyways, look at the clinical scenario. Diagnosis is anaphylaxis. Frequently they ask about treatment. How am I going to use? What am I going to use for treatment? Excellent. What am I going to use for treatment, guys? Treatment, I'm going to use epinephrine 1:1000 intramuscular route 0.3 to 0.5 milligrams. If both are in the option, 0.5 milligram would be a better answer. So remember, anaphylaxis is a very important topic, is frequently asked, right? Intramuscular adrenaline 1:1000, 0.3 to 0.5 milligram. If 0.3, 0.5 both are given, go for 0.5 milligram. All right. Now let's move on to the next question. Patient suffered RTA, road traffic accident, spinal cord trauma, blood pressure is 80/40, pulse is feeble. What is the diagnosis? What is the diagnosis? Come on, guys. Think. What is the diagnosis? What is the diagnosis? Road traffic accident, spinal cord trauma. And there is shock. Obviously, it's a shock. To begin with, it's a shock. Excellent, excellent, excellent. Most of you have given the right answer. Guys, it's a case of neurogenic shock. Right. So the most common cause of neurogenic shock is spinal cord trauma that is seen mostly during road traffic accidents. And your sympathetic thoracolumbar part, it supplies your blood vessels, causes vasoconstriction. That is gone. You will have vasodilatation. That is called as neurogenic shock. Now, once I've made the diagnosis, neurogenic shock, what is the treatment? What is the drug of choice? What is the drug of choice? See, doubts I'll cover at last. Doubts we'll discuss at last, not now, right? What is the drug of choice? So neurogenic shock. What is the drug of choice? Excellent, guys. Some of you have started giving the right answer. It is norepinephrine. Norepinephrine. So remember, norepinephrine, it is a drug of choice in 3 types of shock. See, anaphylactic shock, epinephrine is the drug of choice, right? Neurogenic shock, neurogenic, cardiogenic shock, and septic shock. For all of these 3, the drug of choice is norepinephrine. So anaphylactic shock, epinephrine, septic shock, cardiogenic shock, neurogenic shock, norepinephrine. And remember, the route is IV. The route is not intramuscular here. The route is not intramuscular. So guys, in this page I've discussed, so the more frequently see norepinephrine, this is not that commonly asked. Most commonly asked is this one, anaphylactic shock. We're clear with that. Excellent, all of you. Most of you have answered right. Now let's move on to the next one. During labor, female develops nausea and vomiting followed by low blood pressure. So there is a female in the labor develops nausea and vomiting followed by low blood pressure. So in other words, it is what? Hypotension. So this is a clinical case. So what is the diagnosis here? What is the diagnosis? So we'll talk about another drug of choice here. What is the diagnosis? See, whenever you do an NVD, normal vaginal delivery, it is labor, right? Normal vaginal delivery. What is the type of anesthesia you use? What is the type of anesthesia? We use what? Spinal anesthesia. We use drugs like lidocaine. Right? And our aim is to block the lumbar area. But sometimes there can be a higher level block. So lidocaine, if it can cause thoracic block, again, just like neurogenic shock, there can be low blood pressure because of block of the thoracic level, right? Higher level block. And this is called as LA, local anesthesia induced hypotension. And why have I given here the case of labor? Because it is more common. It is more common during labor. And local anesthetic induced hypotension whenever I give it by spinal anesthesia, or I can say spinal anesthesia induced hypotension. Diagnosis. So remember, spinal anesthesia induced hypotension, the initial presentation is nausea, vomiting, initial presentation, followed by low blood pressure. So what is the treatment? What is the drug of choice for this? Come on, what is the drug of choice for it? What is the drug of choice for this? Spinal anesthesia. So I'm telling you, see, nowadays, you might have seen in the last 2 years, FMGE exam is nothing different than NEET PG. It is exactly same as NEET PG, right? The level is same. And the MCQs are not direct. They'll not ask you, what is the drug of choice for spinal anesthesia induced hypertension? No, they're not going to ask. They'll give you such a case, right? And the drug of choice, see, is hypotension. So try to understand the basic fact. If it is hypotension, I'm going to use a vasoconstrictor. And the vasoconstrictor of choice here is phenylephrine. I'm going to use a vasoconstrictor, and the vasoconstrictor. So guys, I've taught you this. All the teachers, wherever you have done your class, they must have taught you this. Phenylephrine, right? But so remember phenylephrine. But the problem with phenylephrine is, see, it can cause bradycardia. So for example, if there was mention of low blood pressure plus low heart rate, then my answer would have been ephedrine. Remember, if there is bradycardia associated, then phenylephrine cannot be used because phenylephrine's side effect is decrease in heart rate, whereas ephedrine does not decrease heart rate, right? So low heart rate, if it is mentioned in our MCQ in this question, there is no mention of low heart rate. There is no bradycardia. That is the reason why I can go with ephedrine, right? So phenylephrine. Look at the next MCQ. Patient complains of dizziness, vertigo in standing position. So once he gets up, he has dizziness, vertigo, but absolutely normal on sitting position. So what is the diagnosis? When he's lying down, when he's sitting, he is absolutely fine. But as soon as he gets up, he complains of dizziness, right? तो जैसे वो बैठा रहता है तो नॉर्मल रहता है, जैसे ही खड़ा होता है उसको चक्कर आने लगते हैं. And whenever a patient comes to you, you will measure blood pressure. While he is sitting and while he is standing. How do you diagnose this? Excellent. Most of you have given the right answer. You'll measure the blood pressure while sitting and standing. You'll find a difference. And excellent. The diagnosis is postural hypotension. And whenever you have a case of postural hypotension, what is the drug of choice for postural hypotension? Excellent, guys. The drug of choice is midodrine. For postural hypotension. This has been asked. So actually this is hiding on my back. Midodrine is the drug of choice. Excellent. Pushpa, you're right. More than 20 mmHg and 10 mmHg in systolic and diastolic. So midodrine, it has been asked. It has not been asked in FMGE exam, but it has been asked in NEET PG. In NEET PG exam, they have asked what is the drug of choice for postural hypertension. So be prepared. They can ask in FMGE exam as well. Let's move on, guys. A male presents with complaints of urgency and frequency. Right? There is a male patient comes to you with urgency, frequency, and he also had high blood pressure on evaluation. Right? So what is the diagnosis? A male patient comes to you and he has complaints of urgency, frequency. मतलब आपको क्या कहता है कि डॉक्टर साहब मेरे को बार बार पेशाब आता है, बार बार मेरे को टॉयलेट जाना पड़ता है. I have to go frequently to the toilet, right? And when you evaluate him, you find that it's a case of BPH. So it's a case of, excellent guess, it's a case of hypertension with BPH or benign prostatic hyperplasia, right? Benign BPH, right? And in this case, the drug of choice are alpha-1 blockers like prazosin. And remember another important point that is frequently asked about prazosin, it is also drug of choice in scorpion bite. It has been asked multiple times in your FMG exam, right? Scorpion bite is also drug of choice in scorpion bite. Excellent. Tamsulosin is not the drug of choice, guys. Tamsulosin, if they ask you only BPH, then your answer would be tamsulosin or silodosin in case of only BPH. But here, it is a case of hypertension with BPH. All right. A female, suppose they give you a case, they give you such cases, a female suffering from anxiety disorder was found to have high blood pressure. Female suffering from anxiety disorder was found to have high blood pressure. So basically, a female comes to you in your medicine OPD or psychiatry OPD and complains of anxiety. डॉक्टर साहब मुझे कुछ अच्छा नहीं लगता, सब कुछ अच्छा नहीं लगता, हमेशा लगता है कि कुछ होने वाला है. And not goserelin, guys. Goserelin is drug of choice for prostate cancer. And remember, prostate cancer is not BPH. BPH is different. Goserelin is drug of choice for prostate cancer. So she's having anxiety disorder. And you know that whenever female will come to you, obviously you'll do the basics, right? You'll do the basics, baseline investigation. BP was high, right? So it's a case of anxiety disorder. It's a case of hypertension with an anxiety disorder, right? And for treatment, I'll be using beta blocker. Now remember, for anxiety disorders, I will use an SSRI as well. I'll also use an SSRI, right? I'll also use an SSRI. But the antihypertensive, you know that I have to use an antihypertensive here as well. The antihypertensive of choice is beta blocker, right? But SSRI will also be used here, right? As SSRI will also be used in this case. Excellent, guys. Most of you are correct. Patient was started on an antiarrhythmic and he developed torsades. Patient, it's a very frequently asked MCQ. It has been asked multiple times in FMGE, NEET, PG, INI set everywhere. Patient was started on an antiarrhythmic drug and he developed torsades, right? Torsades. And you know what is torsades? Is because of QT prolongation, right? QT prolongation. So, which is the culprit? Which is the culprit? Now, excellent. It's class 1A and class 3. Antiarrhythmic, there are two. Now, if you cannot remember each and every drug, I have asked you in my classes to remember at least one. Q for QT prolongation and Q for quinidine. So I told you, if you cannot remember everything, at least remember one drug. At least remember one drug, that is quinidine. Q for QT prolongation, Q for quinidine, right? So class 1A and class 3, they can cause QT prolongation, they can cause torsades, they can cause torsades. Treatment, if there is treatment, drug of choice is magnesium sulfate. Now look at question number 2. Patient was started on antiarrhythmic and he developed blue-gray pigmentation, right? What is the causative? What is the causative? What is the causative? What is the causative drug here? Again, this is a drug that is frequently asked. Excellent. The causative one is amiodarone. So guys, remember, amiodarone, everything is important, right? It's a drug which is very important. It's a drug which is very important. So two things which are commonly asked from antiarrhythmics. One is QT prolongation. Second one is amiodarone. These two things are commonly asked in your exam. So be it photosensitivity, pulmonary fibrosis, you take any side effect is frequently asked with amiodarone, right? So blue-gray pigmentation. Patient of MI develops difficulty breathing, tachypnea. See, why I'm giving you the questions in such a pattern? Because you have to make a diagnosis nowadays. You have to make a diagnosis. Then only you can get to the treatment. There is a patient of MI. He comes to you. Obviously, he's going to have chest pain and all. But now, post-MI, he's saying, I'm not able to breathe. And there is a high respiratory rate. Right. So what is it? What is it? Patient of MI develops difficulty breathing and tachypnea. So if you look at these symptoms, come on. What is it? Excellent, guys. Excellent. So you see, all of you need to comment. You need to find out the diagnosis, because I told you, nowadays, the MCQs are more clinical. They won't give you a direct MCQ, right? So it is a case of acute CHF. And I've taught you this. The most common cause of acute CHF is myocardial infarction. And acute CHF, how would you treat? See, treatment of acute CHF, I'll use two drugs. You have to remember, what are the two drugs I use? Dobutamine plus furosemide. So at least this much you have to remember. Acute CHF, I use an inotrope, that is dobutamine. I use a diuretic, that is furosemide. Furosemide plus dobutamine. If I know this much, at least I'm safe for the FMG exam whenever they ask you for treatment. So what am I going to use in this patient, right? Dobutamine plus furosemide. Look at the second question. Patient was started on a drug for CHF and he complained of yellowish vision. Now again, this is a drug which is frequently asked, quite frequently asked, right? Quite frequently asked. Patient was started on a drug for CHF and he complained of yellowish vision. Right, excellent, guys. So this is caused by digoxin. And see, digoxin, it is used for treatment of chronic CHF, right? Digoxin, it is used for treatment of chronic CHF. And even in chronic CHF, the first drug that is used is furosemide, remember. Even in chronic CHF, the first drug that is used is furosemide. And this is to control the volume overload. Then I use ACE inhibitor, ARB, and beta blockers. Right. So whenever they ask you in chronic CHF, which is the first drug used, again your answer would be furosemide. Right. ACE inhibitor, ARB, which is the first drug that is used. These are used to decrease mortality. There are lots of them, but I'll not discuss all the drugs. We don't have time. So mostly they ask you which of the following drug is used in heart failure to decrease mortality. You'll see your answer would be ACE inhibitor, ARB, or beta blocker. Remember, furosemide does not decrease mortality. Furosemide does not decrease mortality. Right? ACE inhibitor, ARB, or beta blocker, they decrease mortality. Even digoxin, it is only used for symptomatic relief. Right? So even digoxin does not decrease mortality. So in chronic CHF, mortality is not decreased by furosemide and digoxin. All other drugs, they decrease mortality. Right? All right. So you need to know everything about digoxin, guys. So remember, what did I say? Here, digoxin, like amiodarone, digoxin is a 5-star drug. Everything you need to know about digoxin, their mechanism of action, their uses, their side effects, their contraindication, everything, right? Patient of hypertension was started on a drug and she developed. Now, antihypertensive drugs are important, right? Antihypertensive drugs are important. And these MCQs over the years, they have been asked and they will be asked because hypertension is going nowhere. It's a very common disorder. So swelling of eyelids and lips, first of all, this one. Antihypertensive disorder, antihypertensive was started. And there are 4 questions here. If there is an antihypertensive causing swelling of eyelids, excellent. So these are ACE inhibitors, right? And you yourself know how many times this has been asked. So ACE inhibitors, there are 2 things they ask you. There are 2 things they ask you with ACE inhibitors. Remember, what are the 2 MCQs they ask you? Which antihypertensive causes a dry cough or which can cause angioedema? So this is a case of angioedema. Second, they ask you which antihypertensive is contraindicated in pregnancy. Again, your answer is ACE inhibitor or ARB. So these are 3 MCQs which are frequently asked. Right? Ankle edema. Which one is this? Which one is this? Ankle edema. Antihypertensive causing ankle edema. So I told you, today's session is more about active recall. So if you have revised well, you should be able to recall, right? You should be able to recall. Ankle edema. Ankle edema. Which class of drug causes ankle edema, guys? Excellent. CCB. Calcium channel blockers, they cause ankle edema. Remember, calcium channel blockers, they cause ankle edema. Constipation. It has been asked. Constipation. Come on. Calcium channel blockers, they can cause ankle edema. Constipation. Antihypertensive causing constipation. Which is the drug? Come on, guys. Constipation, guys, it's a very simple MCQ. It has been asked multiple times in NEET PG. In FMGE also it has been asked. Come on. Constipation. At least Harshit has given us the right answer. Verapamil, guys. So whenever they ask you verapamil can cause constipation. Don't forget this. Verapamil can cause constipation. Renal defect in the baby. Which antihypertensive can cause renal defect in the baby? CCB again, but remember, constipation is not seen with all calcium channel blockers. It is specific only for verapamil. Renal defect in the baby. Antihypertensive causing renal defect in the baby. Come on, guys, come on. Renal defect in the baby. I told you earlier why pregnancy is a contraindication for ACE inhibitors, right? Because drugs like ACE inhibitor, ARBs, they can cause renal defect. ACE inhibitors, ARBs can cause renal defect. That is why they are contraindicated. So hypertension, antihypertensive drugs, they're commonly asked. And these are the ones. See, I cannot revise everything in 1 to 2 hours, but we have to revise the most important ones, right? Let's move on. A patient of stable angina was started on a drug that ब्लॉक सोडियम चैनल, कम ऑन आंसर द फर्स्ट वन. एक पेशेंट को, स्टेबल एंजाइना का पेशेंट है, एक ड्रग स्टार्ट किया जो कि सोडियम चैनल को ब्लॉक करता है, राइट? देयर इज अ ड्रग दैट ब्लॉक्स सोडियम चैनल्स. सो विच वन इज दैट? In case of angina, most MCQs are on mechanism of action. Most MCQs are on mechanism of action. All right. All of you have given the wrong answer. I'm sorry. The drug is called as ranolazine. Ranolazine is a sodium channel blocker. Ranolazine is a sodium channel blocker. If you are not able to remember, just remember this. What is sodium? What is sodium? Na. And what is this? If you go opposite, Ran. The beginning of this is An, sodium, right? So you can just use this simple logic to remember, right? This is a simple hack to remember if in case you forget. So guys, it's important. Blocks funny channel. Which drug blocks funny channel? Which drug blocks funny channel? Excellent. Ivermectin. Ivermectin blocks funny channel. Which drug in angina acts via cyclic GMP? Which drug acts via cyclic GMP? Which drug acts via cyclic GMP? See, nitroprusside, it acts via cyclic GMP, but nitroprusside is not used in angina, my friend. Excellent. It's nitrates. And usually they'll give you nitroglycerin in the option. Usually they'll give you nitroglycerin in the option. Right. So they might give you clinical case. They might give you clinical case like a patient complains of palpitation, chest pain after he walks for 50 meters. What is the drug that should be used here? And that is how you can write the answer as these drugs of angina which are used. Patient was started on a drug to decrease LDL and develops myopathy. So patient was given, so he might be suffering from any disease like MI or angina or diabetes. He was given a drug to decrease LDL and he develops myopathy. It's a simple one. Which one is that? Which one is that? Excellent, guys. Your answer would be statins. So see, remember, statins causing myopathy is a frequently asked MCQ. Apart from myopathy, statins, they cause hepatotoxicity and insulin resistance. These 3 points are, these are very important points. Statins causing myopathy, hepatotoxicity and insulin resistance. But remember, it causes hepatotoxicity, but we do not monitor LFT. We do not monitor LFT. It causes insulin resistance, but we do not monitor blood sugar. It causes myopathy, but we do not monitor CPK. It means what? I do not monitor anything. Monitor. But before starting statins, I will do a baseline LFT. मतलब स्टैटिन देने से पहले मैं LFT करूंगा, लेकिन बाद में फॉलोअप नहीं करता, राइट? Longest acting and most potent statin. Longest acting and most potent. Excellent. Some of you have already given the answer here. It is rosuvastatin. Longest acting and most potent statin, rosuvastatin. And they also ask you which is the statin which can be given in morning. This is another MCQ, and same, it can be given in morning because it is longest acting. Otherwise, statins are given at night time, right? PCSK9 inhibitor. This is the recent MCQ that was asked in your last exam, one of the exams. So they might ask you. See, pitavastatin is most potent, but it is never in the options, right? PCSK9 inhibitor. PCSK9 inhibitor. This was asked recently in one of the exams. In an FMGE exam, they might ask you because, excellent. So it is being used now. It is evolocumab and alirocumab. Evolocumab and alirocumab. Now remember, in these sumabs, the C here stands for circulation. So the MCQ, if they ask you, दिस वॉज द रीजन, ये सबसे लेटेस्ट एमसीक्यू पूछा गया था अभी रिसेंटली. एंड वाई हैव दे स्टार्टेड आस्किंग, बिकॉज दीज आर बीइंग रिसेंटली यूज, मतलब इंडिया में इनका यूज कॉमन हो गया, राइट? पीपल आर यूजिंग इट. NPC1L1 inhibitor, this has been asked a lot of times in NEET PG and sometimes in FMG. NPC1L1 inhibitor, which one is this drug? Excellent, guys. Azithromycin. NPC1L1 inhibitor, azithromycin. Now remember, all these drugs that we have discussed here, all these drugs, their aim is to decrease LDL. Nowadays, the preferred drugs to decrease LDL are statins, PCSK9 inhibitor, NPC1L1 inhibitor. They're preferred to decrease LDL. Now, what is the drug of choice for hypertriglyceridemia? What is the drug of choice for hypertriglyceridemia? What is the drug of choice for hypertriglyceridemia? Fibrates. Excellent, guys. The answer is fibrates are drug of choice for hypertriglyceridemia, which means what? Fibrates, they're preferred to decrease triglycerides. So remember, to decrease LDL, basic knowledge, to decrease LDL, I can use statins, PCSK9 inhibitor, azithromycin. To decrease triglycerides, I use fibrates. Niacin is not that frequently used nowadays. Because it's very hepatotoxic and all side effects are there, right? All right. A patient of jerky movements after awakening. So there is a patient. So in this type of question which I'm asking, I'm giving clue words, right? Clue words or the catchword. Jerky movements, and the catchword here is after awakening. मतलब पेशेंट झटके मारता है, झटके मारता है कब? सो के उठने के बाद. सो वेन एवर द पेशेंट गेट्स अप फ्रॉम स्लीप, ही कम डॉक्टर साहब, सो के उठने के बाद थोड़ी देर के बाद मैं झटके मारता हूं, राइट? जैसे ऑटो स्टार्ट होता है ना. सो जर्की मूवमेंट्स आफ्टर अवेकनिंग. व्हाट इज द डायग्नोसिस? The keyword, obviously jerky movements is also keyword, but after awakening is the keyword. सो के उठने के बाद अगर जर्क्स आते हैं, दिस इज कॉल्ड एज, दिस अ क्लासिकल केस ऑफ JME और जुवेनाइल मायोक्लोनिक एपिलेप्सी, राइट? सो रिमेंबर, सो आई टोल्ड यू, nowadays they will not give you direct MCQs. You will feel as if you are treating patients, right? 300 patients, most of the questions. So patient comes and then they'll ask you what is the treatment, right? What is the treatment? The treatment here, the drug of choice would be valproate, right? The drug of choice is valproate. All right. A child presents with episodes of brief staring and it is precipitated by hyperventilation. These are all catchwords. Child presents with episodes of brief staring, right? And it is precipitated by hyperventilation. So guys, the diagnosis here, it is absent seizure. And once, if they ask you clinical case on absent seizure, for treatment, remember the drug of choice now, your better answer would be ethosuximide. If ethosuximide is not in the option, then you can go for valproate. Next question, C. Excellent. All of you have given the right answer. I'm really proud of all of you. An infant has abnormal movements of upper and lower limbs, right? Upper limbs and lower limbs simultaneously, resembling salute, right? So what is this? Infant. So what is the diagnosis here? So the children, the upper limb and lower limb, they simultaneously contract as if the infant is saluting. So these are called as salam spasms, and these are seen in, these are infantile spasms, and they do not give you sometimes infantile spasm. They will give you West syndrome, where you have salam spasm or salam spells. See, these are all the catchwords: infantile spasm, salam spasm, West syndrome, and the drug of choice here is ACTH. So it has been frequently asked in your exams, what is the drug of choice for salam spasm or these things, right? Vigabatrin if tuberous sclerosis is present, but it is rare. So vigabatrin is not that a frequently asked MCQ. But anyways, you know this and that's really great, right? So I'm revising only those which are frequently asked. A patient was given anti-epileptic and he developed. So let us quickly revise some of the important side effects. Pancreatitis, come on, what is the answer? Patient was given anti-epileptic. So one MCQ they can ask you that he was given anti-epileptic, he developed pain in abdomen, and when we did the analysis of blood, amylase was raised. So they can give a clinical case, right? So be pragmatic, keep your eyes wide open, right? So again, your answer here would be valproate. Second, a patient was given anti-epileptic and he developed hyponatremia. So what is the answer here? Hyponatremia. A patient was given anti-epileptic and he developed hyponatremia. So see, remember here, oxcarbazepine would be a better answer as compared to carbamazepine, right? So this is one point that is commonly asked nowadays, how oxcarbazepine is different from carbamazepine, in that oxcarbazepine causes more hyponatremia. Oxcarbazepine, remember this point. Carbamazepine causing hyponatremia is not the talk of the town nowadays in your exams. They ask you how is oxcarbazepine, the newer one, the better one, is different. It causes more hyponatremia. Then how is it better? It is better because it causes lesser hypersensitivity. Hirsutism and hyperplasia of gums. It has been asked many times. It is still asked because phenytoin is still a very commonly used drug in the government setting at least. Stevens-Johnson syndrome. See, lamotrigine and carbamazepine both can cause. Lamotrigine and carbamazepine. And lamotrigine, this is the reason why it is started at low dose. Lamotrigine is started at low dose, right? This is one MCQ that was asked in FMGE a few years back. Started at low dose, lamotrigine. So we basically sensitize the patient. Visual field defect. Which one is this, guys? Visual field defect, vigabatrin. Teratogenicity, that is neural tube defect. Which drug can cause neural tube defect? I mean, frequently associated, more common cause among antiepileptics. It is most teratogenic. These are all important MCQs, and it is valproate. So remember, valproate, it is most teratogenic. Now tell me which is least teratogenic. Valproate is most teratogenic, right? Again, they have asked you this in FMG exam, which is least teratogenic drug, or which is the drug of choice for epilepsy in pregnancy nowadays. It's not lamotrigine. Drug of choice for epilepsy in pregnancy. If you have been taught lamotrigine, please change it in your notes. Your better answer would be levetiracetam. Now remember, if it is not in the option, then go for lamotrigine. Right, 3 years back, they had asked this MCQ in FMG exam. Lamotrigine was not in the option. They had given levetiracetam for obvious reason. Nowadays, the more preferred is levetiracetam. So see, least teratogenic, levetiracetam. Epilepsy in pregnancy, levetiracetam. Right? These are the MCQs which can be asked here. All right, tell me, which antiepileptic causes renal stone and glaucoma? Which antiepileptic causes renal stone and glaucoma? These are again two important MCQs. Which antiepileptic drug causes renal stones and glaucoma? Come on, guys. Come on. Excellent. Topiramate causes renal stones and glaucoma. So these are again frequently asked MCQs, renal stones and glaucoma. Moving on. Patient with liver failure was to be given a benzodiazepine. It's a very frequently asked MCQ across all exams, be it NEET PG, FMGE, INI set, everywhere. Patient with liver failure was to be given a benzodiazepine. So which are the drugs I'm going to use here? I'm going to use here the short acting, right? Like lorazepam, oxazepam, estazolam, and temazepam. So these are four drugs. These are four drugs, short acting drugs. These are four drugs, short acting drugs, which are preferred in liver failure. So remember, in benzodiazepine, nowadays, this is where your more than 70% MCQs are asked. So they'll ask you, it is liver failure, or if it is not liver failure, they'll give you elderly, right? Or they'll ask you which benzodiazepine has no active metabolite. So these are three type of MCQs. Liver failure, elderly, or no active metabolite, same. Answer would be same. A patient presented with difficulty in sleep onset. What is the treatment? So patient आया आपके पास, बोला डॉक्टर साहब मेरे को नींद नहीं आती, रात भर लेट करके मैं छत को निहारता रहता हूँ. Means is not able to induce his sleep. What is the drug of choice? What is the drug of choice? Now remember, guys, the drug of choice are not Z compounds. The drug of choice is Rameltion. And if there is no response, then only I'll go for Z compounds. Remember, if they ask you which is the best drug, try to understand the MCQs. Best drug, obviously, best would be Zolpidem. But the drug of choice is not Zolpidem. Best is Rameltion. Why? Because Zolpidem has a high risk of development of addiction. And later you might not be able to get off Zolpidem, because whenever you get off Zolpidem, you develop something called as rebound insomnia, right? So for sleep induction, for sleep maintenance, so this is for induction of sleep. For sleep maintenance, the drug of choice, remember, nowadays it is suvorexant. It is orexin antagonist, right? Or this is called as a DORA, dual orexin receptor antagonist. And if there is no response, then I go for Zolpidem. So remember, according to the recent guidelines, Rameltion and suvorexant has replaced Zolpidem as the drug of choice, right? Now in blind people, it is different. It is not Rameltion. In blind people, the drug is called as Tacimelton. For blind people, it is Tacimelton. Rameltion is for everyone. So remember this. Whatever you have studied for insomnia, this is the recent guideline, right? I'll go for Rameltion or suvorexant. If there is no response, then I go for Zolpidem. If they ask you which is the best drug, obviously Zolpidem. A neonate was born with hypoxic ischemic encephalopathy and seizures followed. It's a classical case. If you'll see in the gynae department, as soon as the baby is born, the baby might be born and the baby might have hypoxia because of multiple reasons, because of the cord around the neck or protracted labor. Anything can cause hypoxia and that can cause seizure, right? So what is the preferred drug here? Excellent, guys. So seizure in neonates here, our answer is phenobarbital, right? So see, we write these things. I've taught you this, that drug of choice for seizure in neonates is phenobarbital, but they won't give you a direct MCQ. They'll give you like this: born with hypoxic ischemic encephalopathy and then seizures were developed. What is the answer? Phenobarbital. TCA, see, tricyclic antidepressant, they're not that commonly used nowadays. But if used, then we are always worried about toxicity. Why? Because of suicidal attempts. Depression, patients, they have suicidal attempts, and there is a high risk of fatality with tricyclic antidepressants. High risk. Right. So what is the biggest problem? They had asked once in NEET PG, what is the biggest problem with TCA? The problem is if someone commits suicide with just 5 tablets of amitriptyline, the 5 tablets can kill the patient. So dosing becomes a problem. So excellent, guys. The answer is sodium bicarbonate for treatment. Drug of choice for TCA toxicity is sodium bicarbonate. Is not alkalinization. Guys, it is not alkalinization. Sodium bicarbonate acts directly on the heart. The reason being, TCA, they have quinidine-like effect. They have quinidine-like effect on heart, and they can also produce torsades, quinidine-like effect or torsades. But here I'm not using magnesium sulfate. I'm using rather sodium bicarbonate, because what it does is it makes the drug unionized. And if the drug is unionized, because see, tricyclic antidepressants, TCA, these are basic drugs. TCAs are basic drugs. And when the medium is basic, TCA becomes unionized, right? And for TCA to bind to the sodium channels in the heart and potassium channels in the heart, sodium and potassium, I need them to be ionized so that they can bind. So they can, anyways, we don't go into the details. Just remember, drug of choice is sodium bicarbonate. Depression with insomnia or erectile dysfunction, how would you treat? This frequently asked nowadays. There is depression. Obviously, if it is only depression, my drug of choice or first line are either SSRIs or SNRIs. Anyone can be used. But if there is insomnia or erectile dysfunction, that it becomes a problem. The reason being, both SSRI and SNRI can cause insomnia and erectile dysfunction, right? Right, guys. So what will be the answer here? Excellent. Most of you have given the right answer, guys. Mirtazapine. So remember, they do ask you this MCQ. Erectile dysfunction is not seen with. Erectile dysfunction, when they ask you, it is not seen with mirtazapine and bupropion. These are two important drugs. There are some new drugs, but I'm not going into those new drugs. Right. Rajesh, see, suicidal tendency, sometimes we might not know about when the patient is gonna, do suicide. So we cannot, obviously. So that is a reason why we do not want to use. TCA is very rarely used for depression nowadays. So they ask you which are two antidepressants which do not cause erectile dysfunction, mirtazapine and bupropion, right? Drug of choice for acute mania. So mania, they frequently ask, guys. Mania is an important disorder, they ask. Drug of choice for acute mania, it is not lithium, it is not lorazepam. I mean, I don't know who has taught you this. Acute mania, drug of choice are atypical antipsychotics, right? Atypical antipsychotics, drug of choice for acute mania. Yeah, very good. Like aripiprazole. Acute mania, drug of choice, atypical antipsychotics like aripiprazole. Plus, we do start lithium as well. But lithium is not the drug of choice, guys, remember. Because lithium will take minimum 4 weeks to act. Plus minus benzodiazepine. So benzodiazepine is plus minus, means if I feel the need, I can use benzodiazepine, otherwise it is not required. Mania, prophylaxis and bipolar disorder. Mania, prophylaxis, bipolar disorder. What is the answer? Come on. Mania, prophylaxis and bipolar disorder. The second part. Mania, prophylaxis and bipolar disorder. For this word. Guys, mania, prophylaxis and bipolar disorder, the answer would be lithium. Now coming to the most important MCQ. This is a very frequently asked MCQ. Range of lithium. What is the normal range of lithium? Come on, guys. What is the normal range of lithium? See, 0.8 to 1. Please don't remember 0.8 to 1.2. 0.8 to 1.2. Remember this one. 0.6 to 1.5. This is more accepted. Because in your MCQs, they'll give you this 0.8 to 1.2, you'll be confused. You'll be confused. Remember this. All right. Toxicity is seen when? Toxicity is seen when? Toxicity. Toxicity is seen when? So remember, 0.6 to 1.5 is a range that is more important. 0.6 to, so toxicity more than 1.5. So normal range is 0.6 to 1.5. Toxicity more than 1.5, right? Dialysis when it is done. Dialysis. Come on, jaldi. Dialysis, when dialysis is done. When is dialysis done? Toxicity more than 1.5. Dialysis more than 4.0. So remember this. These are the three important ranges. And if I divide it for prophylaxis 0.6 to 1.0. Treatment, it is 1.0 to 1.5. So remember, these ranges are frequently asked. Right? These ranges are frequently asked. Come on. A patient with head trauma was given morphine. Is it correct line of management? Yes or no? Patient comes to you in the emergency with head trauma, right? Head trauma. And you want an analgesic. Can I use? No. Excellent. Why? No. No is the right answer. Why? Why it is no? Because what is the side effect of morphine? It can increase ICP, intracranial pressure. Excellent. So with morphine, this is the frequently asked MCQ, single most point, which is most important. Analgesic of choice in cancer patient. Which is the analgesic of choice in cancer patient, guys? Cancer patient. Cancer. Analgesic of choice in cancer patient. Analgesic of choice in cancer patient. Cancer patient, like multiple myeloma causing bone pain or different metastasis causing bone pain. The analgesic of choice in cancer patient, it is morphine. So remember, whenever they ask you analgesic of choice in cancer patients, in labor, in myocardial infarction. So अगर आपसे पूछेंगे दर्द कम करने के लिए कैंसर के पेशेंट में, एमआई के पेशेंट में, बच्चा जब पैदा हो रहा है लेबर के समय, द प्रिफर्ड ड्रग इज मॉर्फिन, which is the opioid with antidepressant action. इससे मिलता जुलता similar MCQ has already been asked in FMG. I've just changed it a little bit. Opioid with antidepressant action. Which is an opioid with antidepressant action. Come on. All right. Which is an opioid that blocks reuptake of serotonin and norepinephrine. This was the MCQ that was asked in FMG and NEET PG as well. दोनों में पूछा जा चुका है. देखो ये जो MCQ है इसको मैंने चेंज कर दिया थोड़ा सा. This MCQ I've changed little bit. Which blocks reuptake of serotonin and norepinephrine? Now you know the answer is tramadol. Right, tramadol is the answer. भाई देखो मैंने क्या किया है, मैंने उसको चेंज कर दिया. Serotonin norepinephrine reuptake is blocked by tricyclic antidepressant, SNRI. Isn't it? So what I've done, I've just asked you opioid with antidepressant action. Same. Answer is tramadol. Opioids used to decrease withdrawal symptoms. Opioid dependence में withdrawal symptom को कम करने के लिए किसको यूज करते हैं? In opioid dependence to decrease withdrawal symptoms, which drugs are used? Naloxone is used for opioid toxicity. Naloxone is used for opioid toxicity. To decrease withdrawal symptoms, we use two drugs. Methadone and buprenorphine. At least I'll tell you one technique how to remember. See, withdrawal starts with W. W को उल्टा कर दो, क्या हो जाएगा? M. So at least one drug you can remember like this, right? That is methadone, right? So methadone, it is used to decrease withdrawal symptom. Now some of you have given the answer as naltrexone. Naltrexone, it is not used to decrease withdrawal. Naltrexone, it is used to prevent relapse. Naltrexone, it is used to prevent relapse. So remember, these are two different MCQs. Don't blindly jump into naltrexone, naloxone like drugs. Naloxone is drug of choice for opioid toxicity. Naloxone is drug of choice for opioid toxicity, right? Naloxone is drug of choice in opioid toxicity. It has nothing to do with these opioid dependence. So withdrawal symptom कम करना है, M for methadone. At least एक ड्रग तो याद रख सकते हो, prevent relapse, naltrexone. Opioid with alpha 2 receptor agonism. This can be asked. ये आज तक पूछा नहीं है, but they can ask you, which are the receptors with alpha 2 receptor agonism? I mean, which are the opioids with alpha 2 receptor agonism? Which are the opioids with alpha 2 receptor agonism? All right, very good. One is tramadol and second one is pethidine. Two drugs, tramadol and pethidine. If you don't know this, it's okay. Two drugs which are alpha 2 receptor agonist, tramadol, pethidine, and this is the reason why both can be used in post-operative chills. Both can be used in post-operative chills because both are drugs with alpha 2 receptor agonism. Let's move on, guys. Patient of Alzheimer's disease was given donepezil, right? But with inadequate response. Next drug to be combined is, right? So this is one clinical case. Alzheimer's disease patient, all of you know what is the drug of choice in Alzheimer's? It is donepezil. Donepezil is the drug of choice. It's a cholinergic drug. Patient is not responding. What is the next drug that should be combined? See, donepezil is the most effective drug in cholinergics. So rivastigmine or galantamine, they are not as effective as donepezil. So if donepezil is not effective, rivastigmine or galantamine will not be effective. And remember, there is no point in combining one class to another class. For example, if I ask you a patient is not responding to captopril in hypertension, will you tell me that, okay, let us combine enalapril? No, right? It is absurd. Similarly, here we'll not be combining rivastigmine. Here, your answer would be memantine. Memantine, which is an NMDA blocker. So remember, what is the use of memantine? This question say, what am I supposed to learn here? Memantine is never used alone for treatment of Alzheimer's. It is only used after donepezil or any other cholinergics when the patient is not responding. And usually it is required in moderate to severe cases, because moderate to severe cases are the ones which will not respond, And for remember, for Alzheimer's, there is a new drug called as aducanumab. A for Alzheimer's, A for aducanumab, N for neurology, and it blocks beta amyloid. So remember, the drugs of Alzheimer's, the neurodegenerative drugs are very important, even if they are new drugs. So aducanumab, एक बार सुन लेना, बस एक बार देख लेना, क्या पता एग्जाम में आ जाए. A patient with tremor, bradykinesia and history of check bounce. What is the diagnosis? तो पेशेंट आया, उसको ट्रेमर है, ब्रेडिकाइनेसिया है, चलने में दिक्कत हो रहा है, और कहता है डॉक्टर साहब पिछले कई समय से मेरा चेक बाउंस हो रहा है. Right? Patient with tremor, bradykinesia and history of check bounce. All right, so it is a case of what? PD, Parkinson's disease. Parkinson's disease. Patient with tremor, bradykinesia, history of check bounce. It is Parkinson's disease. अब देखो ट्रीटमेंट बेसिकली याद रखना, if the patient is less than 65 years, we use pramipexole. If it's more than equal to 65 years, we'll use levodopa. Next, a patient presented with progressive muscle spasticity due to motor neurons death. What is the diagnosis? तो पेशेंट आया आपके पास कि मेरे मसल स्टिफ हो गए हैं, पाँव स्टिफ हो गए हैं, मैं चल नहीं पा रहा, पाँव घिसड़ घिसड़ के चलेगा, मसल्स आर स्टिफ, मैं अपने हाथों को मोड़ नहीं पा रहा. तो सपोज पानी पीना, तो पानी कैसे पियोगे? पानी नहीं पी पा रहा, राइट? So what is the diagnosis? Very good. The diagnosis is ALS, amyotrophic lateral sclerosis. So whenever it is about muscle spasticity, and there are two drugs, Riluzole and Edaravone. बस नाम याद है, बाकी कुछ नहीं याद रखना. Just remember the name. ALS, amyotrophic lateral sclerosis, two drugs, Riluzole, Edaravone can be used. तो यहाँ पे if they ask MCQ, they'll ask you about the name of the drugs, right? A mountaineer developed nausea, vomiting, and breathing difficulty due to rapid ascent. What is the diagnosis? तो माउंटेनियर है, पहाड़ पे चढ़ता है, और पहाड़ पे चढ़ने का ना एक रेट होता है, that this many meters you should climb in a definite time. अगर आप जल्दी क्लाइम कर जाएंगे तो दिक्कत होगी. Very good. It is acute mountain sickness, right? Acute mountain sickness, nausea, vomiting, breathing difficulty because pulmonary edema हो सकता है. And what is the drug of choice? Acetazolamide. This is a frequently asked MCQ. आपके in FMG exam as well, it has been asked multiple times. Patient with GFR less than 40, what is the diuretic of choice? तो आपको एग्जाम में MCQ देंगे, एक पेशेंट है, उसका GFR बहुत कम है या renal insufficiency है, and what is the diuretic of choice? No, there won't be altered sensorium. Altered sensorium means it is high altitude cerebral edema, HSCE. Then only you'll have altered sensorium. Right, patient with GFR less than 40, what is the diuretic of choice? Yes. No, guys, no. The best diuretic would be loop diuretics. Furosemide will be your answer. देखो, whenever GFR is less than 40, the diuretic of choice is furosemide. Best diuretic in renal insufficiency, oliguria, anuria, they ask you, the best diuretic would be furosemide. Until and unless they'll ask you there is a patient of hypertension, GFR is less than 40, which is the antihypertensive of choice. Now you understand, I will not use a furosemide as a drug for treatment of hypertension, right? So here, what would be the answer? Here, what would be the answer? Here, the answer would be furosemide, right? Here, what is the answer? See, the answer would be obviously a diuretic, and it is the diuretic of choice is metolazone. Metolazone is not chlorothiazide. The only thiazide that is effective with a GFR less than 40. Only thiazide that is effective with a GFR less than 40 is metolazone. Others are not effective, guys. Others are not effective. It is only thiazide, right? Antihypertensive that can worsen diabetes or gout. All right. It has been asked multiple times in FMG exam. आपने एंटीहाइपरटेंसिव दिया और एंटीहाइपरटेंसिव ने डायबिटीज को खराब कर दिया या गाउट को खराब कर दिया, राइट? सो इज एंटीहाइपरटेंसिव. ये पूछा गया, कई बार पूछा गया एग्जाम में. अगेन योर आंसर वुड बी एक्सीलेंट, गाइस. Again, your answer would be thiazides. एंटी हाइपरटेंसिव दैट कैन वर्सन डायबिटीज और गाउट्स. सो देखो, मैं वही चीज़ें डिस्कस कर रहा हूँ जिन पे एमसीक्यूज ज़्यादा कॉमनली पूछे जाते हैं, ताकि आपका रिविजन हो, राइट. एडिमा, 3 एडिमा पे सवाल आते हैं. ड्रग ऑफ चॉइस फॉर पल्मोनरी एडिमा. व्हाट इज ड्रग ऑफ चॉइस फॉर पल्मोनरी एडिमा? Pulmonary edema. Drug of choice in pulmonary edema, guys. Right. What is the answer? Furosemide. What is the drug of choice in cirrhotic edema? Furosemide. Very good. Pulmonary edema means furosemide. What is the drug of choice in cirrhotic edema? What is the drug of choice in cirrhotic edema? Cirrhotic, cirrhosis, cirrhotic. Spironolactone. What is the drug of choice in cerebral edema? Mannitol. Right. Cerebral edema, mannitol. 3. So 3 edema, you have to remember, these are absolutely, and the most frequently asked is this one. सबसे commonly इस पे पूछा जाता है सवाल. Pulmonary edema पे क्यों पूछते हैं? Because MI common है, right? Diuretic. अच्छा, then they ask you which diuretic can cause pulmonary edema. इसका एक साइड इफेक्ट है. Mannitol can itself cause pulmonary edema. Mannitol can itself cause pulmonary edema, right? Diuretic that can cause gynecomastia and hyperkalemia. What is the answer here, guys? Diuretic that can cause gynecomastia और hyperkalemia. तो इस पे भी सवाल आता है. Clinical cases आते हैं. There is a patient with these findings. Potassium levels are raised. Which drug should not be used? Your answer is excellent. Excellent. Answer is spironolactone. Right. Let's move on quickly. Drug of choice. We'll discuss some important drugs of choice. So antimicrobials में drug of choice से ज़्यादा सवाल आते हैं. Syphilis. Come on, let's quickly. Comment quickly as fast as possible. What is the drug of choice for syphilis? Come on, quick. Syphilis, penicillin G. Excellent. Benzathine penicillin G. What is the drug of choice for gonorrhea? Come on, quick. What is the drug of choice for gonorrhea? Penicillin, excellent. Gonorrhea का drug of choice क्या है? What is the drug of choice for gonorrhea? Remember, for gonorrhea, the treatment has changed. It is only ceftriaxone. Now, if you have watched old lectures, because last year the treatment changed. Remember, it is not azithromycin, it is not ceftriaxone plus azithromycin, it is not ceftriaxone plus doxycycline. Only ceftriaxone is the drug of choice for gonorrhea. Last year, the treatment has changed, right? Gonorrhea. Typhoid. What is the drug of choice for typhoid? Typhoid. So if there is a case of typhoid, what is the drug of choice? Ceftriaxone. What is the drug of choice in a case? IV ceftriaxone. What is the oral drug of choice? Cefixime. Right. So this is for a case. If there is a carrier of typhoid, what is the drug of choice? Ciprofloxacin. Carrier of typhoid, ciprofloxacin. So case of typhoid, ceftriaxone. Oral drug of choice, cefixime. Carrier of typhoid, ciprofloxacin. टाइफॉइड इंडिया में कॉमन है, पता है आपको. जब भी किसी को बुखार होता है, सर्दी जुकाम होता है, बुखार होता है, तो बुखार अगर पता नहीं अभी क्यों बुखार है, तो टाइफॉइड, मलेरिया सब टेस्ट कराते हैं हम. मेनिंजाइटिस. व्हाट इज द यूनिवर्सल ड्रग ऑफ चॉइस फॉर मेनिंजाइटिस? व्हाट इज द यूनिवर्सल ड्रग ऑफ चॉइस फॉर मेनिंजाइटिस? See, ceftriaxone, if it is not in the option, then they'll give you cefotaxime. So ceftriaxone or cefotaxime. Cefotaxime. If ceftriaxone is not in the option, they'll give you cefotaxime. Come on, guys. This is easy one. MRSA. What is the drug of choice for MRSA? Come on, quick. What is the drug of choice for MRSA? Come on, faster. What is the drug of choice for MRSA? Vancomycin. Excellent. What is the drug of choice for VRSA? What is the drug of choice for VRSA? MRSA, VRSA. What is the drug of choice for VRSA? Excellent. Vancomycin. All of you know this. I know this. Vancomycin. What is the drug of choice for VRSA? Excellent. Daptomycin. Not linezolid, guys. VRSA drug of choice is daptomycin. Only if it is VRS and pneumonia, sorry, then I go for linezolid. Pseudomembranous enterocolitis, PME, is pseudomembranous enterocolitis. Come on, what is the drug of choice for pseudomembranous enterocolitis? What's the drug of choice for pseudomembranous enterocolitis? Are pseudomembranous enterocolitis? Pseudomembranous enterocolitis. Remember, the drug of choice now it has changed into fidaxomicin. Is not vancomycin. Fidaxomicin is the current drug of choice for pseudomembranous enterocolitis. Fidaxomicin. Pseudomonas. What is the drug of choice for pseudomonas? Come on, faster guys. Jaldi answer karo. Pseudomonas. What is the drug of choice? What is the drug of choice for pseudomonas? What is the drug of choice for pseudomonas? Come on. Faster. What is the drug of choice for pseudomonas? It's not clindamycin. Ceftazidime. Ceftazidime is the drug of choice. And what do I add in case of severe case? I add an aminoglycoside like gentamicin. So there are two types of MCQs. Severe case hai. In severe case, life-threatening pseudomonal infection, ceftazidime plus aminoglycoside. Otherwise, I can go with ceftazidime. Rickettsia, guys. What is the drug of choice for rickettsia? Come on. Doxycycline. Excellent. What is the drug of choice for plague? Treatment of plague. What is the drug of choice for plague treatment? Plague. Right. Rickettsia, doxy is great. Plague, excellent. Plague is strepto or gentamicin can be used in case of plague. So these are some of the important drugs of choice here, which we covered. Drug of choice for atypical pneumonia, guys. Come on, faster. Jaldi revise karo. What is the drug of choice for atypical pneumonia? What is the drug of choice for atypical pneumonia? Atypical pneumonia, macrolides, excellent. Which is the macrolide of choice? Azithromycin. What is the drug of choice for diphtheria? Come on, azithromycin, atypical pneumonia. We know that. Diphtheria. What is the drug of choice for diphtheria? Diphtheria का drug of choice क्या है? Come on. What is the drug of choice for diphtheria? Diphtheria में penicillin कौन दे रहा है भाई? Diphtheria. Erythromycin, excellent. Erythromycin, diphtheria, erythromycin. Atypical pneumonia, azithromycin. What is the drug of choice for toxoplasmosis? Normal people, I'm not asking about pregnants. Toxoplasmosis. We use a combination of two drugs. And what is that combination? Toxoplasmosis. Sulfadiazine plus pyrimethamine. Combination of two drugs we use, sulfadiazine plus pyrimethamine. Spiramycin, remember, spiramycin is used only in case of pregnancy. Pneumocystis, guys, what is the drug of choice? Come on, faster. Pneumocystis, what is the drug of choice? Sulfadiazine plus pyrimethamine. Pneumocystis is frequently asked. Pneumocystis is commonly asked. What is the drug of choice for pneumocystis? Jaldi. Come on. Jaldi type karo. Come on. What is the drug of choice for pneumocystis? Cotrimoxazole. What is the drug of choice for a contact of meningococcal meningitis? Is a frequently asked MCQ. What is the drug of choice? What is the drug of choice for a contact of meningococcal meningitis? Jaldi. Come on. Contact of meningococcal meningitis. कई बार सवाल पूछा गया आपके एग्जाम में. Contact of meningococcal meningitis. Very good. Cipro. Rifampicin answer नहीं होगा. Rifampicin is no longer the answer. All right. What is the drug of choice for cryptococcus and mucormycosis? Come on. Fast. ये दोनों पे सवाल आता है. Cryptococcus, mucormycosis. जल्दी आंसर दो. What is the drug of choice in cryptococcus and mucormycosis? Excellent. Lamb. liposomal amphotericin B. What is the drug of choice for severe falciparum malaria? Liposomal amphotericin B. Excellent. Severe falciparum malaria. What is the drug of choice? Jaldi, come on, come on, come on, come on, come on. Artesunate, artesunate IV. IV artesunate is the drug of choice in case IV artesunate is the drug of choice in case of severe falciparum malaria. Candidiasis. What is the drug of choice for candidiasis? Candidiasis. What is the drug of choice in candidiasis? Come on, jaldi, 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 jaldi answer karo, jaldi answer karo. What is the drug of choice for candidiasis? It's a very simple one. It's a very simple one. Fluconazole. Excellent, excellent. Let the answers flowing. Aspergillosis. Come on, guys. Come on, come on. Excellent, excellent. What is the drug of choice for aspergillosis? Come on, jaldi, jaldi, jaldi. Aspergillosis का drug of choice क्या है? What is the drug of choice for aspergillosis? Aspergillosis. Others Pandey meningitis I've told about overall. Voriconazole, very good. What is the drug of choice for tinea capitis? Excellent, excellent. Come on, guys. Tinea capitis or carrion, infection of scalp. Tinea capitis or carrion, infection of scalp. What is the drug of choice? Come on. Tinea capitis or infection of scalp, right? What is the drug of choice? Come on, जल्दी 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 आंसर करो, जल्दी आंसर करो. Tinea capitis, what is the drug of choice? कई सवाल पूछा गया कई बार. NEET, PG, FMG, they have asked. This is the only condition where griseofulvin rules still, and that is tinea capitis. This is the only condition where griseofulvin still rules, right? Still rules. Right, now let's have a look at some of the important side effects. Antibiotics causing pseudomembranous enterocolitis. Now, if they ask you today, which is a better answer? What is the more common cause? Come on. Antibiotics causing pseudomembranous enterocolitis. Antibiotics causing, very good. Your answer would be either third generation cephalosporins or amoxi or ampicillin. So usually, if they ask an MCQ, these would be the answer. Third generation cephalosporin, amoxi or MP. Antibiotic causing seizure. Seizure कौन करेगा? जल्दी करो. ये पूछा गया है. ये आपका एग्जाम में FMG में पूछा गया है. Right? Seizure. Which antibiotics they can cause seizure? Which antibiotics they can cause seizure? Seizure, seizure, seizure. Seizure. Nani, yeah, video will be available later, but it is more of, for active participation. Right. Excellent. So you're giving the right answer. Imipenem and moxifloxacin. केवल यही दो हैं जिन पे आंसर आता है आपको. Imipenem, moxifloxacin. Yellow teeth, पीली दांत. Yellow teeth. Which are the drugs that can cause yellow teeth? Tetracyclines, right? Tetracyclines. Vestibular toxicity, where they can ask you patient has tinnitus, vertigo, ataxia, right? Vestibular toxicity. Excellent. One answer can be streptomycin. What could be the second answer? दो ड्रग्स पे सवाल आता है. एक स्ट्रेप्टोमाइसिन है, दूसरा मिनोसाइक्लिन है. So one is streptomycin, second one is minocycline. So one is streptomycin, second one is minocycline. Vestibular toxicity. Auditory toxicity, remember if they ask, mostly it is maximum with amikacin. So this will be the answer. QT prolongation. Which are the drugs that cause QT prolongation? QT prolongation कौन से करते हैं? QT prolongation कौन से drugs करते हैं? QT prolongation. Now, forget about, I'm asking about antibiotic. Antibiotic causing QT prolongation. Don't drag amiodarone and quinidine here. Antibiotic causing QT prolongation. Very good. Macrolides. What else? Fluoroquinolones. Moxifloxacin. Moxifloxacin. See, moxifloxacin is an important drug. Moxi has maxi, seizure, QT prolongation, and half-life. Maxi has maximum liver excretion, right? And that is why this is the only fluoroquinolone which is safe in renal failure, plus it is not used in UTI. ये सारे MCQs हैं, एक ही ड्रग है, वन ड्रग मॉक्सीफ्लॉक्सासिन, ये सारे MCQs हैं. सीजर सबसे ज्यादा कौन करेगा? मैक्सिमम सीजर. QT प्रोलॉन्गेशन, लॉन्गेस्ट एक्टिंग कौन सा है? लिवर से एक्सक्रीशन किसका होता है? रीनल फेलियर में सेफ कौन सा है, या लिवर फेलियर में सेफ कौन सा नहीं है? यूटीआई में कौन सा यूज नहीं होता? बिकॉज फॉर अ ड्रग टू बी यूज्ड इन यूटीआई it has to go via kidney. Tendinitis, which drugs cause tendinitis? TB drugs also cause, I know that, bedaquiline, delamanid. Tendinitis, very good. Tendinitis, it is caused by fluoroquinolones. Crystalluria, which antibiotic causes crystalluria? Crystalluria. Sulfonamides, very good. Which antibiotic causes motilin receptor stimulation? Again, this is an MCQ that has been asked both in NEET PG and FMGE. Motilin receptor stimulation. Motilin receptor stimulation. It's not, it's macrolides, guys. So remember, M for motilin, M for macrolides. M for motilin, M for macrolides, right? Antifungal causing nephrotoxicity. So few MCQs. Antifungal, they don't have that much MCQs. So which is the antifungal drug that is known to cause? It's a very potent nephrotoxic agent. It's a very potent nephrotoxic agent. Come on. Good evening, Harashima. Good evening. We have joined late. Good evening to all of you. Right. So amphotericin B. Amphotericin B causes nephrotoxicity. They ask, what do we do to prevent? To prevent nephrotoxicity, I use NaCl and liposomes. So nephrotoxicity. Amphotericin B is nephrotoxic. To prevent, I use either normal saline or I use liposomal formulation of this drug, which is the antifungal causing gynecomastia. Which is the antifungal drug that causes gynecomastia. Come on, jaldi. Time nahi hai, jaldi bolo. Gynecomastia, ketoconazole. Very good. Antiretroviral drug causing anemia. Jaldi karo, jaldi. Anemia, antiretroviral drug causing anemia. Antiretroviral drug, which is the antiretroviral drug that causes anemia. Antiretroviral drug. मतलब HIV का कौन सा ड्रग अनीमिया करता है? अनीमिया करता है बिकॉज इट कॉजेज बोन मैरो सप्रेशन. भाई अनीमिया करता है मतलब क्यों? बिकॉज इट कॉजेज बोन मैरो सप्रेशन. यस, कम ऑन, जल्दी. अब तो बता दो. बोन मैरो सप्रेशन की वजह से अनीमिया. ज़िरोवुडीन, हाइपर पिगमेंटेशन ऑफ पाम्स एंड सोल्स. हाइपर पिगमेंटेशन ऑफ पाम्स एंड सोल्स. एम्ट्रीसाइटामाइन, देखो ये एंटी रेट्रोवायरल, मतलब सिर्फ HIV के ड्रग के बारे में पूछ रहा हूं. हाइपर पिगमेंटेशन ऑफ नेल्स, ज़िडोवुडीन कैन कॉज नेल पिगमेंटेशन. रिमेंबर. रीनल स्टोन्स, चलो ये बता दो, ये कई बार सवाल पूछा गया है. कम ऑन फास्टर. रीनल स्टोन, विच एंटी HIV ड्रग कैन कॉज रीनल स्टोन? विच एंटी HIV ड्रग कॉजेस नेफ्रोलिथियासिस और रीनल स्टोन? जल्दी कमेंट करो, जल्दी बताओ. जल्दी बताओ. कम ऑन गाइस. ये आसान है, ये पूछा गया है, कई बार पूछा गया है. रीनल स्टोन्स, इंडिनाविर, राइट. सो इंडिनाविर, जब मैंने एग्जाम दिया था, व्हेन आई गिव एग्जाम, तब ये सवाल पूछा गया था, आज भी सवाल आता है. इंडिनाविर, राइट. और इंडिनाविर कॉजेज रीनल स्टोन्स. और कैसे याद रखना, देखो मैंने कैसे याद किया था, जब मैं तैयारी कर रहा था तो इन्फॉर्मेशन बहुत सारे होते हैं. सो यू नीड टू यूज एनी काइंड ऑफ वेग लॉजिक, लाइक मैंने याद किया था इंडियन अवीर में इंडिया है और इंडिया के रोड पे क्या मिलता है, इंडिया के रोड पे पत्थर ही पत्थर मिलता है. सो यू कैन ट्राई टू मेक एनी काइंड ऑफ स्टोरी, एनी काइंड ऑफ कुछ ना कुछ कनेक्शन बना दो ताकि याद रहे. एंटी रेट्रोवायरल ड्रग्स कॉजिंग डिसलिपिडीमिया. डिसलिपिडीमिया, ज्यादातर डिसलिपिडीमिया कौन से ड्रग्स करते हैं? डिसलिपिडीमिया, which class of drug they cause dyslipidemia most of the times? Very good, these are protease inhibitors. Chalo, let's move on. How to prevent lipodystrophy due to insulin injection? So insulin को inject करते हैं on the subcutaneous fat, right? तो बार बार whenever we inject insulin multiple times, there is a risk of lipodystrophy. How to prevent that? It's not Z-track. Z-track बिल्कुल अलग चीज है. देखो नितिन गडकरी ने रोड अच्छा बना दिया. मेरे टाइम में तो नितिन गडकरी नहीं था ना भाई, मेरे टाइम में तो रोड सही में बहुत खराब थे भाई, राइट? तो मैं उड़ीसा से हूँ, तो उड़ीसा के रोड के हालत तो और भी खराब थे. तो लोग कहते हैं ना कि मतलब रोड में गड्ढा होता है, तो उड़ीसा में यह हालत था कि गड्ढों के बीच में रोड ढूंढना पड़ता था कि थोड़ा थोड़ा रोड बचा होता था, राइट? वेरी गुड, वेरी गुड. सो रोटेट द साइट ऑफ इंजेक्शन, और जो डिस्टेंस है 1 इंच, द डिस्टेंस शुड बी 1 इंच, मिनिमम 1 इंच, 1 इंच. या वेरी गुड, very good, you're from Odisha. So but it's not like that now. Odisha 90s का जो दौर था उड़ीसा में, it was very difficult, lot of people were poor and all, but now Odisha has come a long way, and at least मतलब आजकल ये है कि कम से कम कोई भूखा नहीं मरता. 90s में ऐसा था कि लोगों को 2 टाइम खाना मिलना भी मुश्किल होता था, राइट? बट अभी कम से कम 2 रुपए वाला चावल मिलता है ना हर जगह, 2 रुपए वाला चावल, तो कम से कम चावल है. So rotated site of injection 1 inch, 1 inch, right? Most common site of insulin injection कौन सा है? Come on, जल्दी जल्दी. What is the most common site of insulin injection? What is the most common site of insulin injection? Most common कौन सा साइट है? कौन सा साइट है? कौन सा साइट है? अरे साइड मतलब बॉडी में पूछ रहा हूँ, सबक्यूटेनियस नहीं. एब्डोमेन, एब्डोमेन एक्सेप्ट पेरी एम्बिलिकल. याद रखना, पेरी एम्बिलिकल साइट में इंजेक्ट नहीं करते. वी डोंट इंजेक्ट ऑन द पेरी एम्बिलिकल साइट. एंड व्हाई एब्डोमेन? बिकॉज सी, एब्जॉर्प्शन इज फास्टेस्ट एंड मोस्ट रिलायबल फ्रॉम एब्डोमेन, राइट? तो बॉडी में आप कहीं भी इंजेक्ट कर लें, जो सबसे जल्दी एब्जॉर्प्शन होगा वो एब्डोमेन से होगा. प्लस जो प्लाज्मा वैल्यू है हमेशा आफ्टर इंजेक्शन वो एक जैसा रहेगा, उसे हम कहते हैं रिलायबल एब्जॉर्प्शन. ऑलराइट, व्हिच इज द फास्टेस्ट एंड शॉर्टेस्ट एक्टिंग इंसुलिन? फास्टेस्ट एंड शॉर्टेस्ट एक्टिंग इंसुलिन. फास्टेस्ट एंड शॉर्टेस्ट एक्टिंग इंसुलिन. नो 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 नो, यहां पे आप लोगों ने धोखा खा गए. इट इज करेंटली the inhalational insulin Afrezza. It is not Lispro aspart glulisine. No, no, no. It's not Lispro aspart glulisine. Remember, Afrezza inhalational insulin is not nasal. भाई नाक में इंसुलिन नहीं देते. You inhale it. It goes into the lungs, not into the nose. It goes into the lungs, and because lungs have a huge network of capillaries, inhalational route is a very fast route, right? चलो जल्दी जल्दी आगे बढ़ते हैं. एंटी डायबिटिक ड्रग कॉजिंग हाइपोग्लाइसेमिया, राइट? सो वेन एवर दे आस्क यू अबाउट एंटी डायबिटिक ड्रग कॉजिंग हाइपोग्लाइसेमिया, you remember the drug has to be insulin or the drug has to release insulin. So you remember क्लास में मैंने आपको बेसिक कॉन्सेप्ट समझाया. I've given you the basic concept. The drug has to be insulin. Maximum hypoglycemia is caused by insulin, or it has to release insulin, like सल्फोनेलयूरिया और मैग्लिटिनाइड और GLP-1 एगोनिस्ट, DPP-4 इनहिबिटर के साथ कम दिखता है. So whenever they ask you which drug do not cause hypoglycemia, most of the times your answer is a metformin or pioglitazone. ये नहीं करते. Lactic acidosis, come on, lactic acidosis is a very simple one. जल्दी आंसर करो. Lactic acidosis, जल्दी टाइम नहीं हमारे पास, जल्दी करो. Metformin, excellent, metformin. Bone fracture in females, come on. Bone fracture in females, जल्दी आंसर करो. बोन फ्रैक्चर इन फीमेल्स, केवल महिलाओं में बोन फ्रैक्चर कौन सा ड्रग करता है? जल्दी कमेंट करो यार, जल्दी कमेंट क्विक. बोन फ्रैक्चर इन फीमेल्स, रिमेंबर बोन फ्रैक्चर इन फीमेल्स, योर आंसर विल नॉट बी canagliflozin. बोन फ्रैक्चर इन फीमेल्स, योर आंसर वुड बी pioglitazone or rosiglitazone. Canagliflozin can cause bone fracture, but it has no sex predilection. मेल या फीमेल में ऐसा कोई उसका झुकाव नहीं है. Alright, tell me, which is the anti-diabetic drug that can cause CHF or congestive heart failure? Anti-diabetic drug that can cause CHF or congestive heart failure. Anti-diabetic drug जो कि हार्ट फेलियर कर सकता है. जल्दी बताओ दोस्तों, जल्दी बताओ. पढ़ाया हुआ है मैंने आपको, ये पढ़ा रखा है मैंने. एंटी-डायबिटिक ड्रग जिससे हार्ट फेलियर हो सकता है, बिकॉज वो जो ड्रग है, वेरी गुड. द आंसर इज अगेन the glitazones like pioglitazone, rosiglitazone, etc. Right? They can cause CHF because they can stimulate INAC, epithelial sodium channels, and can cause edema. All right, come on. This one is an easy one. Anti-diabetic drug causing UTI. Right? UTI. Come on, जल्दी कमेंट करो यार. आसान है ये पूछा गया है, कई बार पूछा गया है. Gliflozin, UTI. Gliflozin. All right. Anti-diabetic drugs causing weight loss. Anti-diabetic drugs causing weight loss. Anti-diabetic drugs causing weight loss. Weight loss. कौन से drugs हैं? Weight loss. GLP-1 agonist करेंगे weight loss. GLP-1 agonist, very good. Metformin करेगा weight loss. What else? Who else causes weight loss? GLP-1 agonist, metformin, and gliflozins also cause weight loss, the SGLT2 inhibitor. And that is why GLP-1 agonists like semaglutide or liraglutide are the drug of choice for treatment of obesity. Right? So semaglutide, liraglutide, obesity में use होते हैं. They're preferred. If they ask a single one, semaglutide is preferred. Flatulence. Which class of anti-diabetic drugs can cause flatulence? Right? Gas, meteorism. कौन से ड्रग करते हैं? Flatulence. पेट में गैस कौन से ड्रग करते हैं? Flatulence is a side effect of which class of drug? Very good. Is caused by alpha glucosidase inhibitors. Like acarbose, voglibose. So these are the important side effects which they can ask in your exams. All right, Gozerelin, intermittent dosing. What are the uses? Come on, jaldi. Gozerelin, it is GnRH agonist. Intermittent dosing में कहाँ use होगा? Gozerelin, intermittent dosing. जल्दी. प्रोस्टेट कैंसर में गलती हो जाएगा दोस्तों. प्रोस्टेट कैंसर में गलती हो जाएगा. प्रोस्टेट कैंसर कंटिन्यूअस डोजिंग में यूज होता है. ऑलराइट, कैसे याद रखेंगे? इंटरमिटेंट डोजिंग मतलब आई फॉर इनफर्टिलिटी विच कैन बी बिकॉज ऑफ एन ओवुलेशन और ओलिगोस्पर्मिया. डी फॉर डिलेड प्यूबर्टी. तो आईडी, इंटरमिटेंट डोजिंग, आईडी दो यूजेस हैं. अदर यूजेस आर बाय कंटिन्यूअस डोजिंग, चाहे वो प्रोस्टेट कैंसर हो, चाहे ब्रेस्ट कैंसर हो, चाहे एंडोमेट्रियोसिस हो, चाहे फाइब्रॉइड्स हो, चाहे प्रिकॉशियस प्यूबर्टी हो. बाकी मैं याद नहीं रखूंगा तो भी चलेगा कंटिन्यूअस डोजिंग में, बिकॉज मेरे को पता है कि इंटरमीडिएट डोजिंग में आईडी है इनफर्टिलिटी और डिलेड प्यूबर्टी. राइट? Yes, ultimate to increase LH and FSH. Right? So ID. ड्रग ऑफ चॉइस फॉर acute varical bleeding, come on, जल्दी जल्दी, ये जल्दी जल्दी करेंगे, क्विक, कम ऑन, जल्दी करेंगे ये. Acute varical bleeding, what is the drug of choice in acute varical bleeding? Is not octreotide guys. अभी octreotide नहीं है. Current the drug of choice is terlipressin. The current drug of choice is terlipressin. Current drug of choice is terlipressin. Right? Drug of choice, insulinoma. Tell me, what is the drug of choice for insulinoma? जल्दी 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 जल्दी, अब जल्दी जल्दी बताओ, टाइम खत्म होने वाला है, जल्दी जल्दी बताओ. 20 मिनट बचे हमारे पास, 6 बजे तक अपन रैप अप करेंगे ताकि आप लोग जाओ घर और फिर रिवाइज करो घर में, मतलब जाओ, मतलब एक्सीलेंट. डाइजॉक्साइड. सेक्रेटरी डायरिया, व्हाट इज द ड्रग ऑफ चॉइस? जल्दी जल्दी, कम ऑन. सेक्रेटरी डायरिया, व्हाट इज द ड्रग ऑफ चॉइस? सेक्रेटरी डायरिया. सेक्रेटरी डायरिया, व्हाट इज द ड्रग ऑफ चॉइस इन सेक्रेटरी डायरिया? सेक्रेटरी डायरिया में ड्रग ऑफ चॉइस क्या है? वेरी गुड, ऑक्ट्रियोटाइड. व्हाट इज द ड्रग ऑफ चॉइस फॉर हाइपरथायरॉयडिज्म इन प्रेगनेंसी? What is the drug of choice for hyperthyroidism in pregnancy? बड़ा ये क्या है? Hyperthyroidism in pregnancy. Nothing is mentioned, then go for PTU. Go for PTU. If it is mentioned first trimester, PTU. If it is mentioned second and third trimester, methimazole. Right? Lactation. ये बताओ. Lactation. जल्दी जल्दी. During lactation, what am I going to use? What is the drug of choice for hyperthyroidism in lactation? Lactation. Come on. जल्दी बताओ. Lactation में क्या होगा? Lactation, guys, methimazole. Because propylthiouracil is hepatotoxic to the baby. So lactation में propylthiouracil नहीं है. Lactation में we go for methimazole. Drugs causing gallstones. Two drugs. One, tell me, what are the drugs causing gallstones? केवल 2 drugs हैं जो gallstones करेंगे. There are only 2 drugs that will cause gallstones. Very good. One, fibrates. Someone has given the right answer. Aarti has given the right answer. Second is octreotide. Now remember, if they ask MCQs on gallstones, it is always about either fibrates or octreotide. Drugs causing gallstones, your answer is either a fibrate or octreotide. Alright, जल्दी. ये बहुत simple MCQs हैं. Answer of choice in gout, guys. Come on, जल्दी, quickly answer करो. जल्दी खत्म करते हैं, 15 मिनट बच गए. चलो. Answer of choice in acute gout. in gout. Answer of choice in gout. अरे एनासिड ऑफ चॉइस इन गाउट, एलोप्यूरिनोल एनासिड थोड़ी ना मेरे भाई. एनासिड ऑफ चॉइस इन एक्यूट गाउट. अरे एनासिड, एलोप्यूरिनोल आंसर जो भी कमेंट कर रहे हो, देखो एनासिड थोड़ी ना है एलोप्यूरिनोल. इंडोमेथासिन, एक्सीलेंट. एनासिड अवॉइडेड इन गाउट. विच एनासिड इज नॉट गिवन इन गाउट? Anacid of choice is indomethacin. Which anacid is avoided in gout? Very good, aspirin. It is avoided in gout. So remember, endomethacin, it is drug of choice in acute gout. In chronic gout, drug of choice is allopurinol. So whenever you mark an answer, look at the question carefully. If they ask which is the anacid of choice in gout, don't jump for allopurinol. ये एनासिड थोड़ी ना है भाई, right? Plus they ask you MCQ on this mechanism. Allopurinol acts by blocking which enzyme? Xanthine oxidase. Drug of choice in tumor lysis syndrome. What is the drug of choice in tumor lysis syndrome? Drug of choice in tumor lysis syndrome. देखो, ट्यूमर लाइसिस सिंड्रोम में अगर सॉलिड ट्यूमर है, सॉलिड ट्यूमर जैसे सॉलिड ऑर्गन, लंग कैंसर, लिवर कैंसर, ब्रेन कैंसर, राइट, देन आई यूज एलोप्यूरिनोल. बट इफ इट इज अ केस ऑफ बोन मैरो कैंसर like leukemia, lymphoma, etc., then I go for रास्पबेरी केस, दोनों यूज हो सकते हैं, दोनों यूज हो सकते हैं. सॉलिड ट्यूमर, एलोपेरिनॉल, बोन मैरो कैंसर, रास्पबेरी केस. व्हाट इज द ड्रग ऑफ चॉइस फॉर पीडीए? वेरी गुड, पीडीए आइब्यूप्रोफेन मोर देन इंडोमेथासिन. हालांकि MCQs they are more asked on indomethacin, both can be answered. Alright, what is the drug of choice for rheumatoid arthritis? Jaldi, come on. What is the drug of choice for rheumatoid arthritis? What is the drug of choice for rheumatoid arthritis? Rheumatoid arthritis, rheumatoid arthritis, rheumatoid arthritis, rheumatoid arthritis. Excellent. Your answer is methotrexate. Methotrexate, rheumatoid arthritis. What is its mechanism of action? Remember, it is not via folic acid, it is via adenosine. तो ये दूसरा MCQ आता है. रूमाटोइड अर्थराइटिस में मीथोट्रेक्सेट का मैकेनिज्म इज नॉट रिलेटेड टू फॉलिक एसिड, इट इज रिलेटेड टू एन इंक्रीज एडेनोसिन. Acetaminophen toxicity presents with what? Again, acetaminophen or paracetamol is a very important MCQ, right? Presents with what? मतलब पैरासीटामोल टॉक्सिसिटी का पेशेंट आपके पास आएगा तो क्या होगा? वेरी गुड, योर आंसर वुड बी hepatotoxicity. And what is the metabolite causing hepatotoxicity? NAPQI. What is the metabolite? NAPQI that causes hepatotoxicity. These are all important MCQs. And what is the drug of choice for treatment? What is the drug of choice for treatment? N-acetylcysteine. N-acetylcysteine. If they further ask you, if the patient does not respond to N-acetylcysteine, then what happens? He goes into fulminant liver failure. And if he goes into fulminant liver failure, what can I do as a doctor? The only thing I can do is go for emergency liver transplantation. पर उसके लिए liver भी होना चाहिए पहले, है कि नहीं? Very good. All of you given the right answer. Acetaminophen पे एक MCQ बनता है हर एग्जाम में, right? Beta 2 agonist causing hyperglycemia. Cause hyperglycemia. True or false? True or false? Beta 2 agonists cause hyperglycemia. True or false? Jaldi, come on. Beta 2 agonists, they cause hyperglycemia. True or false? Excellent, true. Right, so remember, this MCQ has been asked regarding drugs like salbutamol. It has been asked like MCQ like ritodrine. So ritodrine is also beta 2 agonist. It was asked in the last FMG exam, right? Last FMG exam. So beta 2 agonists, see what they do. Whenever they ask you which of the following is not seen with ritodrine or salbutamol, they will just change hyper into hypo, and that is the answer. Theophylline causes diuresis because of block of which receptors? So with theophylline, they usually ask about an effect coupled with a receptor, right? With which receptor? Theophylline causes diuresis because of which receptor? Theophylline causes diuresis because of block of which receptor? Excellent. So remember here, your answer is adenosine receptor. See, adenosine receptor, it causes most of the important side effects like diuresis, arrhythmia, and seizure. Remember, so these are all seen because of adenosine receptor block, whereas phosphodiesterase 4 block causes GIT upset and headache. Now this has never been asked, but the MCQs are only asked on this. केवल इसी पे सवाल पूछा जाता है, ज़्यादातर आपको phosphodiesterase पे सवाल नहीं आता. What is the most common side effect of ICS? Inhalational corticosteroid. What is the most common side effect of ICS or inhalational corticosteroid? What is the most common side effect? Now remember, inhalational corticosteroid, candidiasis is not the most common side effect. There's a reason why I'm asking you this question. It is hoarseness of voice. Hoarseness of voice. Most common side effect of inhalational corticosteroid. Most common side effect is hoarseness of voice, guys. It is hoarseness of voice. It is not dry mouth. Dry mouth is the most common side effect of anticholinergics used in COPD like tiotropium, ipratropium. Their most common side effect is this one. Candidiasis can be seen, but candidiasis is not that common, right? PPI can cause bone fracture. True or false? Proton pump inhibitors can cause bone fracture. Proton pump inhibitors, tell me, proton pump inhibitors can cause bone fracture, true or false? PPIs can cause bone fracture, true or false? True, 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 true. PPIs, long-term PPI can cause fracture, which is characteristically seen is hip fracture. So remember, bone fracture, pseudomembranous enterocolitis, etc. These are side effects that can be seen. So in entire GIT, the one topic which is most important is PPI. I'm not asking you anything about PPI use because पेट से कुछ भी होगा use that has to be PPI. Ulcer, GERD, H. pylori, ZES, anything, right? Sucralfate can be given with antacids, true or false? Come on, this one. Sucralfate can be given with antacids, true or false? Sucralfate can be given with antacids, true or false? False, false. Excellent. Well, given the right answer, false. The reason being, if false, इस पे सवाल आता है. The reason being, sucralfate, it needs the gastric acid for polymerization. अगर मैंने एंटासिड के साथ दिया तो एंटासिड क्या करेगा? एसिड को खा जाएगा. Sucralfate will not be polymerized. Right. So remember, it is contraindicated with antacid. A patient post hip joint replacement complained of pain in left leg calf muscles. Right. What is the diagnosis? तो हिप जॉइंट का रिप्लेसमेंट किया, उसके बाद वो लंगड़ाने लगे, चलने में काफ मसल में दर्द होने लगा. क्या है? एक्सीलेंट. DVT, deep vein thrombosis. So what is the drug of choice for treatment and prophylaxis? What is the current drug of choice for treatment and prophylaxis? What is the current drug of choice for treatment and prophylaxis? Remember, it has changed. आज की डेट पे oral drugs, DOAC are drug of choice both for treatment and prophylaxis. DOAC, both are drug of choice for treatment and prophylaxis. बिकॉज ओरल है, LMWH में तो फिर भी आपको अपने आप को निडल मारना पड़ेगा, इंजेक्ट करना पड़ेगा. डोएक, सो ये रिसेंट चेंज है, याद रखना. वारफरिन, LMWH, ये सब सेकेंड लाइन में आ गए हैं. जहां हो सके, जहां पॉसिबल हो, हम हमेशा कोशिश करते हैं डोएक को आगे ढकेलने की. प्रोफाइलैक्सिस ऑफ थ्रोम्बोसिस इन अ पेशेंट ऑफ एट्रियल फिब्रिलेशन विथ मैकेनिकल वाल्व. तो उसके पास एक मैकेनिकल वाल्व है, आर्टिफिशियल वाल्व है, राइट, कृत्रिम वाल्व है, या जो है ये आपका क्या कहते हैं उसको, प्रोस्थेटिक वाल्व है. सो मैकेनिकल वाल्व. सो मैंने आपको समझाया था कैसे याद रखना है. M को उल्टा कर दो, क्या हो जाएगा? W, रिवर्स M into W. सो मैकेनिकल वाल्व, वारफरिन. नेटिव वाल्व, आई विल गो फॉर डोएक. सो नेटिव वाल्व में हम डोएक यूज करेंगे, एक्सेप्ट अगर पेशेंट को, इफ द पेशेंट हैज सीवियर mitral stenosis or the patient has renal failure. In दो केस में I'll come back to warfarin, right? So native valve, ये FMG में सवाल पूछा गया है, FMG में भी सवाल पूछा गया है, नीट PG में पूछा है, INI सेट में भी पूछा है. मैकेनिकल वाल्व आई यूज वारफरिन. नेटिव वाल्व मेरा खुद का अपना वाल्व है, आई यूज डोएक, एक्सेप्ट अगर माइट्रल स्टेनोसिस बहुत सीवियर है मतलब क्या है? सरफेस एरिया इज लेस देन 1.5 सेंटीमीटर स्क्वायर, या रीनल फेलियर है, देन आई विल गो फॉर दिस, राइट. एंटीडोट ऑफ डेबिगेट्रेन. देखो एंटीडोट पे सवाल आता है दोस्तों, एंटीडोट बहुत इंपॉर्टेंट है. व्हाट इज द एंटीडोट ऑफ डेबिगेट्रेन? इन पे सवाल पूछा जाएगा आपको. कम ऑन, जल्दी, थोड़ा सा रह गया, 5 मिनट में निपटाते हैं. Idarucizumab, very good. What is the antidote for apixaban? Apixaban, very good. Apixaban, andexanet alpha. Apixaban, andexanet alpha, right? तो ये हो गया. कोआगुलेशन मॉनिटरिंग इज नॉट रिक्वायर्ड विद. इन पे सवाल आता है दोस्तों, कोआगुलेशन मॉनिटरिंग किनके साथ जरूरत नहीं पड़ता? 1, 2, 3. तीन है, बताइए, तीन है. कोआगुलेशन मॉनिटरिंग इज नॉट रिक्वायर्ड विद, कोआगुलेशन मॉनिटरिंग इज नॉट रिक्वायर्ड विद. नंबर वन, डोएक, LMWH and fondaparinux. So for this, coagulation monitoring is not required. DOAC, LMWH, fondaparinux. Why it is not required? I've explained in the lecture. आज अपने पास टाइम नहीं है, लेकिन जिनके लिए मॉनिटरिंग करना पड़ता है, फॉर दोज वेयर मॉनिटरिंग इज रिक्वायर्ड, MCQ is asked, what do we monitor? So UFH and argatroban, we monitor what? क्या मॉनिटर करते हैं? APTT. APTT. वार्फरिन में क्या मॉनिटर करते हैं? क्या मॉनिटर करते हैं वार्फरिन? व्हाट डू वी मॉनिटर इन वार्फरिन? व्हाट डू वी मॉनिटर इन वार्फरिन? PTINR. वार्फरिन वी मॉनिटर PTINR. सो क्या मॉनिटर करते हैं? राइट, व्हाट डू वी मॉनिटर, दे आस्क, एंड देन दे आस्क फॉर विच मॉनिटरिंग इज नॉट रिक्वायर्ड. दीज आर स्टैंडर्ड MCQs. बट नाउ इट इज द MCQs आर मोर आस्क्ड अपॉन डोएक. तो देखो, आज के लिए ब्लड में जो सबसे इंपॉर्टेंट टॉपिक है वो डोएक है. डोएक इज मोस्ट इंपॉर्टेंट. ऑलराइट, व्हाट इज द एंटीडोट फॉर UFH? व्हाट इज द एंटीडोट फॉर UFH? UFH, अनफ्रैक्शनेटेड हेपरिन का क्या है एंटीडोट? UFH, व्हाट इज द एंटीडोट फॉर UFH? कम ऑन, जल्दी जल्दी बताओ, जल्दी बताओ. प्रोटामाइन सल्फेट, वेरी गुड. व्हाट इज द एंटीडोट फॉर वार्फरिन? वार्फरिन दिया आपने किसी को, उसको ब्लीडिंग हुआ, मर सकता है. I've started warfarin on a patient, he is bleeding, he might die. What should I give? What should I give? It is 4-factor prothrombin complex, 2, 7, 9, 10. Remember, the drug of choice. Now remember, vitamin K is also given, but vitamin K is not the drug of choice. Vitamin K is given, but vitamin K is not the drug of choice. Vitamin K is not the drug of choice. So I give 4-factor PTC or prothrombin complex. 4-factor PTC is the drug of choice, right? FFP इसके बाद आता है. Plus I can give vitamin K. I can give vitamin K, but the main one is PTC. The last thing, guys, the last thing for today's session. Then you can go and continue revision. Tacrolimus cyclosporin inhibit. Here the MCQs are mostly asked upon the mechanism of action. Tacrolimus cyclosporin inhibit what? Tacrolimus cyclosporin, very good. They inhibit calcineurin and they decrease interleukin 2 production. दो चीजें पता होनी चाहिए आपको. You should know two things. Tacrolimus cyclosporin, they block calcineurin and they decrease interleukin 2 production, right? Side effect here, the most important side effect they ask you about is nephrotoxicity. Nephrotoxicity is important. Sirolimus, everolimus, what do they block? What do they block? Sirolimus, everolimus. Come on, come on. क्या block करते हैं? Sirolimus and everolimus. What do they block? Sirolimus, everolimus. क्या block करते हैं? बताओ भाई. वेरी गुड. mTOR. माइकोफिनोलेट मोफेटिल, ये क्या ब्लॉक करता है? माइकोफिनोलेट मोफेटिल. mTOR, वेरी गुड. mTOR, माइकोफिनोलेट मोफेटिल, व्हाट डज इट ब्लॉक? प्यूरिन सिंथेसिस को ब्लॉक करता है. इट ब्लॉक्स IMP dehydrogenase. So it blocks purine synthesis by blocking IMP dehydrogenase. इसके बारे में याद रखना, दुनिया में आज तक का ये सबसे, until now in this world, this is the least toxic immunosuppressant, right? All immunosuppressant, they are known to cause a hell lot of toxicity, right? Basiliximab, it blocks what? It blocks what? Basiliximab, it blocks what? See, B is alphabet number. B is alphabet number 2. So it blocks interleukin 2. It blocks interleukin 2, or it is also called as CD25 as well. Interleukin 2 is also called as CD25. So it blocks interleukin 2 receptor or CD25. Interleukin 2 receptor or CD25. So remember, tacrolimus, cyclosporin, they decrease interleukin 2 production, but it blocks interleukin 2 receptor or CD25. Right, guys. So this is all I intended to revise today. So today's session, it is not about MCQs. It was not about me telling you things, but it was more about you guys recalling whatever you have revised. So this session would be beneficial for those who have already revised. तो हमने कितना टाइम लगाया? 2 घंटे लगाया. 2 घंटे में आप आकर के एक्टिवली रिकॉल करते हैं, और आज जो भी चीज़ें आपने रिकॉल करी हैं इनमें से वो चीज़ें आपको लंबे समय तक याद रहेंगी. यू विल रिमेंबर देम फॉर अ लॉन्गर पीरियड ऑफ टाइम, एंड बिकॉज ऑफ दैट व्हाट विल हैपन इज, बिकॉज ऑफ दिस रीसेंट मेमोरी, यू विल बी एबल टू सॉल्व मोर एमसीक्यूज. और जो भी मैंने पढ़ाया आपको 2 घंटे में, इनमें से आपका कम से कम जो 50% एमसीक्यूज है एफएमजी एग्जाम में, 50% एमसीक्यूज इन्हीं में से आएगा जो मैंने पढ़ा है. रीजन बीइंग, मैंने वही टॉपिक्स कवर करे हैं यहाँ पे, वही चीज़ें कवर करी हैं विच आर मोर फ्रिक्वेंटली आस्क्ड इन द एग्जाम, राइट. एंड I'll do a similar session for NEET PG as well. I will do a similar session for NEET PG as well. Now NEET PG में अभी टाइम है, right? NEET PG में अभी टाइम है. I'm not gonna remove this. So NEET PG के लिए मैं मे बी जैन के एंड में करूँगा, बिकॉज अभी टाइम है, मार्च में है. तो अभी पता है आपको FMG के एग्ज़ाम अभी 20 तारीख को है. तो एग्ज़ाम से थोड़ा पहले करने से, ये सेशंस को एग्ज़ाम से थोड़ा पहले करने से ज़्यादा फ़ायदा होता है. अच्छा, किसी ने मेरे को ये पूछा था कि एंटी मलेरियल फॉर नॉर्थ ईस्ट स्टेट्स. सी, एंटी मलेरियल नॉर्थ ईस्ट में कोई ख़ास डिफरेंस नहीं है. नॉर्थ ईस्ट में अगर फैल्सीपैरम है तो वी यूज़ अ कॉम्बिनेशन ऑफ आर्टिमितर प्लस लूमेफेंट्रिन. बस यही अंतर है नॉर्थ ईस्ट में. बाकी अभी इफ यू हैव एनी डाउट्स यू कैन आस्क मी. टॉपिकल म्यूपिरोसिन इज द ड्रग ऑफ चॉइस. फॉर नेजल कैरियर ऑफ MRSA. टॉपिकल म्यूपिरोसिन इज द ड्रग ऑफ चॉइस. Alright guys, so see, I would not advise you to waste much more time because this, अभी इसका भी PDF लेके क्या करोगे भाई? नोट्स रिवाइज करो. ये तो रिवीजन था. अगर PDF चाहिए तो मैं आपको, अच्छा मुझे बता दो, आप कमेंट बॉक्स में बता दो आपको PDF चाहिए तो मैं बना करके लिंक शेयर कर दूंगा, राइट. PDF चाहिए तो मैं बना करके लिंक शेयर कर दूंगा. बट मुझे नहीं लगता PDF की ज़रूरत है, बिकॉज ये जो सेशन था, it was more about you participating in it and telling me, I mean, how much the answers, and is basically how much you remember. आपको कितना याद है, बेसिकली वो बोलना था. तो PDF चाहिए तो बता दो मेरे को. PDF चाहिए तो मैं बना के आपको अपलोड कर दूंगा. मुझे कोई PDF देने में मेरे को कोई दिक्कत नहीं है. बट ये है कि अभी टाइम इतना कम है, तो इस कम टाइम में एक और नया चीज़ देने का ज़रूरत नहीं है. इस सेशन का मतलब समझ रहे हो? इस सेशन का ज़्यादातर मतलब ये था, मैंने आपको ऑप्शंस नहीं दिए ना. मैंने MCQ नहीं रिवाइज कराया आपको, मैंने आपको ऑप्शन नहीं दिए. तो आपको अपने मेमोरी में से जो भी याददाश्त है, जो भी आपको याद है, उसमें से ढूंढ करके आंसर निकालना था. सो ये एक्सरसाइज जो था वो ज़्यादा इम्पॉर्टेंट था. ऑलराइट, देखो वीडियो सेव्ड है. वीडियो मैं रिमूव नहीं कर रहा. PDF जो है मैं, ठीक है, अगर आप लोग कहते हो PDF में दे दूंगा आपको. ऑलराइट, बाकी ऑल द बेस्ट जितने भी FMG भाई लोग हो, सबको, आप लोगों को ऑल द बेस्ट फॉर एग्जाम्स. एंड अच्छे से रिवाइज करके जाना. इन द लास्ट 3 to 4 days ट्राई टू रिवाइज द एंटायर कंटेंट. 3-4 दिन में एक बार रिवाइज करना. मतलब क्या? फ्लिप थ्रू द पेजेस, राइट, फास्टर, जल्दी, ताकि रिसेंटली आप देखोगे ना, थोड़ा सा कॉन्फिडेंस लेवल आपका हाई रहता है. दूसरा, ये दिस इज़ द थिंग दैट आई टेल एवरीवन, कि आप 300 क्वेश्चन सॉल्व करोगे. यू विल बी सॉल्विंग 300 क्वेश्चन, और 300 में से यू विल नॉट नो द आंसर फॉर ईच एंड एवरी वन. 250 क्वेश्चन, 250 क्वेश्चन के आसपास यू शुड ट्राई टू सॉल्व एटलीस्ट. 50 क्वेश्चन का आंसर आपको नहीं आएगा, चाहे आप कितना भी पढ़ लो, आप कितने बड़े 30 मार्क हो, फर्क नहीं पड़ता. ये जो 50 क्वेश्चन है, मार्क सेम ऑप्शन, मार्क से सेम ऑप्शन ए बी सी डी, इनमें से कोई भी मार्क कर लो, कोई फर्क नहीं पड़ता, देर इज नो लॉजिक बिहाइंड इट, बट मार्क ओनली वन ऑप्शन, राइट। तो ये 50 जो है आप मार्क करोगे तो इनमें से कम एटलीस्ट आपको 10 मिनिमम मिनिमम 10 क्वेश्चन के आंसर आपको सही मिलेंगे, 10 क्वेश्चन के आंसर सही मिलेंगे, राइट। पास होने के बाद मिलना है यार, दिल्ली में, मैं दिल्ली में रहता हूँ, मेरे को मैसेज करो, कभी भी गौतम नगर जाता हूँ, गौतम नगर में कभी भी मिल सकते हो मेरे को, राइट। मेरे को मिलना कोई इतना बड़ा मुश्किल काम नहीं है, मैं बहुत से बच्चों से मिलता हूँ गौतम नगर में, सो दैट्स नॉट अ बिग डील। एग्ज़ाम पास कर लो पहले, मिलना जुलना तो होता रहेगा बाद में, दिल्ली आना जाना लगा रहेगा आपका, राइट। सो ये जो आखिरी के कुछ दिन हैं, इन दिनों में बहुत ज़्यादा एंग्जाइटी बहुत ज़्यादा रहेगी। बहुत से लोग ऐसे रहेंगे जो मेरे को इवन नीट पीजी के बच्चे पूछते हैं, सर नींद नहीं आ रही, या जो बच्चे रात को पढ़ते हैं पर एग्ज़ाम दिन में है तो कैसे वो करें। तो जिनको नींद नहीं आ रही, या अपना रूटीन ठीक करना है, कि जो हम असुर वाला ज़िंदगी जीते थे रात को और दिन में जा सोते थे, तो उसके लिए एक टैबलेट आता है मेलाटोनिन का, 3 mg, 3 mg मेलाटोनिन का टैबलेट है। ये अमेजोन पर भी अवेलेबल है, इट इज़ अवेलेबल इवन इन अमेजोन, इट इज़ अ फूड सप्लीमेंट, इट इज़ नॉट अ कंसिडर्ड एज अ ड्रग। 3 mg मेलाटोनिन, इसको लेना, इसको जो खाने का तरीका है वो थोड़ा सा अलग है, जस्ट आफ्टर डिनर, जस्ट आफ्टर डिनर। तो आपने खाना खाया तुरंत खाना है, बट इसका जो इफेक्ट है, इसका इफेक्ट आता है आफ्टर 2 आवर्स, 2 घंटे के बाद। मतलब आपको थोड़ा सा टाइम करना पड़ेगा। फॉर एग्जाम्पल, अगर मेरे को रात को 10 बजे सोना है, आई एम टू स्लीप एट 10 o'clock, आई नीड टू हैव डिनर एट 8 o'clock, इमीडिएटली टेक द टैबलेट ऑफ मेलाटोनिन, और 10 बजे आपको जो है लाइट वगैरह स्विच ऑफ करके लेट जाना है, बिकॉज मेलाटोनिन ऐसी दवाई नहीं है जिसकी वजह से आपको ड्राउजीनेस आएगा, बट आप लाइट वगैरह ऑफ करके अगर आप लेट जाएंगे 10 बजे, तो आपको नींद आ जाएगा, अगर पहले नहीं आता था, राइट। सो ऑल राइट गाइस, और chanting dog Paras is also here, पारस चैंटिंग किंग। ऑलराइट गैस, अब कितना घंटा पढ़ना है, कितना घंटा नहीं पढ़ना है, वो सब आपके ऊपर डिपेंड करता है। जितना घंटे आप पढ़ सकते हो उतना घंटे पढ़ो, कोई दिक्कत नहीं है। जो करना था आपने कर दिया, जो गाइड करना था हमने कर दिया। देखो, माँ बाप भी एक लिमिट तक ही आपको गाइड कर सकते हैं। माँ बाप ज़्यादा से ज़्यादा आपके लिए लड़की ढूंढ सकते हैं या लड़का ढूंढ सकते हैं, मंगनी करा सकते हैं, बारात ले जा सकते हैं, फेरे करवा सकते हैं भाई, लेकिन कुछ काम जीवन में खुद करना होता है। तो आगे का काम अब आपके अपने हाथ में है, आपने क्या करना है इसके साथ। दिन बहुत कम है, पर अपने ऊपर भरोसा रखना, राइट। नेवर लेट योर सेल्फ डाउन। अगर आपको ये भरोसा, इफ़ यू हैव सेल्फ बिलीफ, आप हमेशा ये जो आखिरी के 10-15 दिन जो बचे, जितने भी दिन बचे हुए हैं, ये समझ करके आगे बढ़ो कि भाई मैं पढ़ क्यों रहा हूँ, क्योंकि मेरे को एग्ज़ाम निकालना है। तो ये जो पॉजिटिव वाइब्स होते हैं, ये जो पॉजिटिव आपका जो माइंडसेट होता है कि मैं कर रहा हूँ, मैं पढ़ रहा हूँ क्योंकि मेरे को एग्ज़ाम निकालना है, तो निकल जाएगा। अगर किसी ने 2-3 सब्जेक्ट नहीं पढ़ रखे, तो अभी वो 2-3 सब्जेक्ट नहीं पढ़ने का। 16 सब्जेक्ट पढ़ रखे हैं, 16 को ही रिवाइज करो। 16 सब्जेक्ट से भी एग्ज़ाम FMG का निकलता है। तो अगर आप मेरे से पूछोगे कि मैं ये जो आखिरी के दिन 3 नए सब्जेक्ट पढ़ूं या जो 16 सब्जेक्ट पढ़ रखे हैं उनको रिवाइज करो, तो जो 16 सब्जेक्ट पढ़ रखे हैं उनको रिवाइज करो। नए जगह पे इन्वेस्टमेंट नहीं करना है। बट गाइस, सो आई टेक योर लीव, टाइम बहुत हो गया है। आई लव ऑल ऑफ यू एंड आई एम लुकिंग फॉरवर्ड टू हियर द गुड न्यूज़ आफ्टर द एग्जाम। टेक केयर गाइस, बाय बाय।